Ok, ba zan ji ba in san magana. So amma kaga ba a fara ba. Okay.
in suka yi ke ce ba su ji magana ki ba
Allah.
Allah ba ke ce ba su ji magana amma ke in su
Good morning. We are all welcome to this session, and sorry for starting a bit late. The facilitator has joined already, so I think we don't need to waste much time. You are welcome. We can start. Thank you.
Yeah. So good morning, everyone. Good morning, everyone. So today we are going to discuss on phase 1. Can you all hear me? Am I audible?
Yes, ma'am.
Okay. So once again, good morning all. Today we are going to discuss on phase 1 and phase 2 of cognitive behavioral therapy. But before then, let's try to recall what we discussed last week. Please, can anyone summarize what we discussed last week? Hello? Nobody is talking. Or are you people new?
I'm new, ma. Good morning, ma.
Okay. You didn't join the last week workshop?
Yes, ma, I didn't.
Okay. Let me just summarize what we did last week so that you have better understanding of what we are discussing today.
Thank
So
you.
last week we introduced cognitive behavioral therapy after talking about sustainable weight loss. And we discussed that sustainable weight loss is a gradual and maintainable way of losing weight over time, you understand? And cognitive behavioral therapy is a psychological or psychotherapy approach to weight loss in which not only the physical part of weight loss is being addressed, even the psychological aspect of weight loss. And the aim of this cognitive behavioral therapy is for us to maintain sustainable weight loss, to maintain the weight we've lost for life. You understand? So that is the aim of this cognitive behavioral therapy, because our traditional method of weight loss only explain or teach a client how to lose the weight, but it's very, very difficult for that weight to be what? Maintained. So I'm very sure you all know that it's even easier to lose the weight than to maintain it. So one of the best way to maintain weight after you've reached your target weight is to what? Is through this cognitive behavioral therapy. And last week, we talked about the science behind weight loss. For you to understand healthy, sustainable weight loss, you have to know the science behind it. And that's where we explained energy system. What is energy system? The component of the energy system. Component of energy system, we talk about the energy input and energy output. That is the energy input, what you've taken in, the energy you've gotten from the food and drink you've taken. So that is our energy input. Our energy output, the energy you expend during physical activity, thermic effect of food, and resting energy expenditure. So this energy system, we have negative energy balance and we have the positive energy balance. Negative energy balance is when your input is lower than your output. For example, let's say the energy you've consumed from the food you eat is 2,000 calories. Then you need 3,000 calories to take care of your energy output. That is, you need 3,000 calories to take care of your resting energy expenditure. Resting energy expenditure is the energy your body use at rest to take care of some physiological process like your respiration, circulation, the activity of the brain, etc. These are activities that take place even if you are at rest. So you need energy to take care of these activities, and that is what we call the resting energy expenditure. Then we now discuss about the thermic effect of food. That is the energy your body use in digesting the food you eat, absorbing the nutrient, and transporting the nutrient to the site of action. So that is the energy. That energy is termed as the thermic effect of food. Then another component of this energy output is what? Activity energy expenditure. That is the energy you used for your daily activities, your daily physical activities and your formal exercises. You understand? So this the component of the energy system, we have the input and the output composed of these three components I've explained. So for you to get negative energy expenditure is when the input is lower than the output. You understand? Maybe what you've eaten is 2,000, and what you need to take care of the three component of the energy output is 3,000. So you are going to get what? A negative energy balance. You understand? And that is where you lose weight. Then we get there are situations whereby scenarios we get positive energy balance, where your output, where your input is what? Above your output. Maybe you've taken 3,000 calories and your output is 2,000 calories. So what you are using out of what you've taken is not up to what you've taken. So you are going to be left with what? Surplus of 1,000. And what will happen? That your surplus will now be what? Converted into fat and be stored in your body. That is how you add weight. So understanding the energy system will give you a clear view about the science of weight loss. If your energy input is above your energy output, you will be what? Adding weight. If your energy input is below your energy output, you will be losing weight. If your energy input is equal to your energy output, you are going to maintain your weight. You are not going to add weight. You are not going to reduce your weight. So we further explain the method, the ways you follow if you want to lose weight. That you are going to start with measurements. You are going to start with measuring your parameters that will help you in the journey. Parameters like your height, your weight, your waist circumference, and your hip circumference. The importance of measuring this is it will give you a clear indication whether to lose the weight or to maintain your weight or to add weight. We use the height and the weight to calculate the BMI, body mass index, which is one of the tools you use to check whether a client needs to lose weight or to maintain it or even to add weight. And how you calculate it is to divide your weight by the square of your meters, by the square of your height in meters. You understand? And the result you get, you now compare it with the range we have for underweight, overweight, or obese, or normal weight. When the value of your calculation is equal or below 18.5, that particular client is underweight, and that client don't need to what? To lose weight. He or she need to add weight. If it is between 18.5 to 24.9, that particular client is within normal weight, and that client don't need to add or don't need to add or reduce weight. He or she should try and maintain that weight at present so that he will not fall below, that is underweight, or above, that is overweight. Then when the value is between 25 to 29.9, it is what? Overweight. That particular client need to lose weight because he or she is at the risk of developing metabolic disorders like diabetes, hypertension, etc. And when the value is above 29.5, that is 30 above, that patient or client is what? At the obese category. And obesity is a risk factor for this lifestyle disease or metabolic disorders that I've mentioned. So, and also another tool we use for this journey is the waist hips circumferences. That is why I said some of the another measurement you take is your waist circumference and your hip circumference. So the waist hip circumference for females, if it should be equal or less than 0.8. If it is above that, there is what? High risk of metabolic disorders. Then for male, one above, that particular client disorders.
Good morning, ma'am. Please, we're not hearing anything, ma'am. Thank you.
Okay, my network. Okay, let me go on.
Okay, ma'am.
And I think I think it's not showing. I'm not sure if they are seeing.
No, we're not seeing the slide has been off.
Okay, can you see the slides?
No, we can't
are not
see
seeing it.
now.
So please, you push your share from your end. Let me just continue.
Okay.
So we are talking about okay, after taking the measurement, the next thing is mindset. So I've explained earlier on that you have to, yes, okay, about the waist hip circumference. I'm done with the measurement. That's the measurement, calculating the BMI and the waist hip ratio. So I've finished explaining the measurement. Then the next thing is for you to educate the client so that he or she will get suitable for weight loss. You have to change his mindset. Find out what he or she is thinking. Find out what he or she is thinking about weight loss. Did he or she believe they can lose the weight, or did they think they cannot because it's hereditary? So try and find out from the client, and in accordance to your findings, then you know what to tell the client. If he or she is thinking, it's hereditary, I can't lose this weight, or I've tried a lot of procedures and I'm not losing the weight, or I've lost weight and I regain it back. Educate the client about sustainable, healthy weight loss approach. Maybe if you ask the client, which method did you follow? That client may explain method that is not sustainable with weight loss. So after getting the mindset for weight loss, then the next thing is for you to educate the patient on realistic weight loss goal. Do not promise unrealistic weight for the patient. Maybe the patient will ask you, Ma, is it possible, or sir, is it possible for me to lose 5 kg in a week? If we are talking about healthy, sustainable weight loss, it's not possible to get that. So please tell the client it's not possible. Tell the client that sustainable healthy weight loss from researchers is 0.5 to 1 kg per week. Then from then, you now educate the client about balanced diet. Yes, what is balanced diet? From the primary definition of balanced diet is a food that contains all the class of food in the right proportion in accordance to your need, whether you want to lose weight or add weight or maintain your weight. Then from then, we further talk on how to explain the importance of regular physical activity to your client. Yes, explain what are the benefit of exercise in weight loss. As I explained last week, that we have different method of losing weight. If you want, you can just take care of your diet and you'll be losing that weight. Or if you like, you can just take care of physical activity and you'll be losing weight, but it's not going to be what healthy or sustained. If you only focus on your diet, reducing your diet to lose weight, you will not only lose fat, you will get to a point whereby your muscles will even be broken down. So when you lose muscles, your metabolism will slow down. And at the end of the day, even if you did not eat food, it will be very difficult for you to lose the weight. And if you focus on exercise, you will be tired, because for you to be able to do the amount of, or the dosage of exercise that will be significant in weight reduction without taking care of your diet, it's not good. It's not easy. It's not easy. Sometimes it's easier to cut down your food intake or your calories than for you to even exercise. For example, if you should take 100 grams of granite, it's equivalent to about 528 calories. While if you should brisk walk for 1.5 hours, you only end up losing 300 calories. So it's better for you to combine the two than for you to just focus on only one component of sustainable weight loss. Another part of this sustainable weight loss is what? Lifestyle modification. You're going to, from your history taking, you are going to get to know some unhealthy habits that your client is used to. For example, junk eating, sedentary lifestyle, not getting enough quality sleep, not hydrating well, not taking enough water. All these are unhealthy habits that need to be addressed if you want someone to lose weight in a healthy manner. So after all this explanation, we went about to talk about the components of this weight loss. And I've already explained diet, exercise, proper hydration, and adequate quality night sleep. Then we further explain the method of losing weight using diet. We talk about two approach, that is calorie estimation and portion control. Okay, for you to understand, it is very important for you to know that every individual, depending on your height, weight, age, and activity level, there are certain calories you need to lose weight. If there is a formula we used last time to calculate, we even did it practically. So if you use that formula to calculate, inputting your age, weight, height, and substituting everything, you are going to get the calorie you need to lose weight. If, for example, after calculation, you got 3,000 calories, you need 3,000 calories. That means you need 3,000 calories to maintain your weight at your present age and weight. If every day you'll be taking 3,000 calories, you are going to maintain that weight. You are not going to lose or add weight. So if you want that particular client to lose weight, you are going to create calorie deficit or calorie shortage. That is, you are going to reduce his maintenance calories. If you want that particular client to lose 1 kg at the end of a week, you are going to create 7,000 calorie shortage or 7,000 calories deficit per week. That means every day from your diet and exercise, you are going to create the shortage of 1,000 calories. From your diet, you reduce certain amount of food to get like 800 calories. Then from your exercise, you try and burn 200 calories. When you add up, it will give you 1,000 calories. So if you do this for 7 days, that is, you get 7,000 calories. And that is, it will translate on your weighing scale as reduction in 1 kg. If you create 7,000 calorie deficit in a week, you are going to lose 1 kg. If it is 3,500 calories in a week, you are going to lose 0.5 kg. So for you to lose the weight, you have to take care of your diet and exercise. And the diet is two approach. We talk about calorie estimation and we talk about portion control. When we are discussing about calorie estimation, that was when we talk about the calculation of calories. And we are meant to understand that each food we eat contains calories, with the exception of salt and water. So if you know your calories, okay, for me to lose weight, my maintenance calories is 2,000 calories daily. For me to lose weight, I need to be eating 1,200 calories. How will you get this 1,200 calories? That is where planning your meals come in. You understand? You are going to plan to distribute this 1,200 calories across 2 meals or 3 meals per day. As I said, it is not healthy to be taking 1 meal per day, because there are some people will tell you, okay, let me just take the 1,200 calories at a go. At once, let me just take 1,200 calories, since that is what I need to lose weight. It is not healthy and it is not ideal. So it is advisable that the calories you need to lose weight should be what shared across 2 meals or 3 meals per day, depending on what you want. And the distribution of the calories should be in accordance to your preference. If you want a heavy breakfast, the calories you take for that breakfast should be more than the one for your lunch and dinner. If you take only 2 meals, equal calories, then you divide it into two, 600 for your breakfast, 600 for your dinner. So now the concern was, how will I know the food to eat, the combination of food to eat to get this 600 calories at a sitting, or to get 1,200 calories in a day? And that was where we discussed about the calories of each food. We were meant to understand that when you take 1 gram of carbohydrate, it's amounting to 4 calories. 1 gram of protein is amounting to 4 calories, and 1 grams of fat is amounting to 9 calories. And that is why we always emphasize that. That is why we always emphasize that you limit your fat intake, because 1 gram of fat almost double the calories of carbohydrate and protein. So I told you that 1 cup, we use measuring cup to estimate the calories of food. It's easier, or weighing scale, food weighing scale, using the grams of food. So if you want to use the measuring cups, I promise to give document at the end of this workshop that contains some of the common food we eat and its calories. For example, a cup of cooked rice is amounting to 240 calories. 1 tablespoon of sugar is amounting to 34 calories or 32 calories. 1 tablespoon of honey is amounting to 64 calories. An egg is amounting to 75 calories. So it's something that has been researched and it's there, it is fixed. You understand? Though you'll be getting some variation. And if you want to even know on your own, based on what you consume or what your client consume, you can browse. If you browse, it's there. You get a lot of places whereby you get the calories of almost everything you eat. You understand? So it's from these calories that you are going to combine the calories you need. For example, you intend to you are on 1,200 calories daily to lose weight, to lose 1 kg weekly, and you intend to take let's say tea, bread, and egg as breakfast. Then your lunch, you intend to take jollof rice. Your dinner, you intend to take, let's say, salad, something light. So for the breakfast, 1 slice of bread, small size, is 80 calories. And the big one slice is 100 calories. So depending on which one you want to take. Let's say you decide to eat the large one of 100 calories. So you are going to take 2 slices of bread. Then you intend to add egg, because you have to balance your meals. As I said earlier, you have to balance your meals. So I intend to take, okay, let's say 1 egg, 1 boiled egg, which is what, 75 calories. So 200 plus 75 calories, you are left with what, 275 calories out of 1,200 calories. Then you plan to take plain tea, plain black tea or spicy tea with 1 tablespoon of sugar, which is 32 calories. So add up the 32 calories to 275 calories, you are going to get 300 plus calories. That is for your breakfast. Then for your lunch, you intend to take jollof rice. White cooked rice, a cup, is amounting to 240 calories. So the jollof rice, let's leave it to what, 400 calories, because of addition of oil, the pepper mix, and everything you use in preparing your jollof rice. So let's say your jollof rice is 400 calories, and you have to add protein to make it balanced. So when you decide to take meat, beef, is a size of matchbox. That matchbox, a size of matchbox, if you are taking beef, that same size is about 130 calories. So 400 plus your 130 is giving you what, 530 calories. So you're going to add vegetable. A cup of salad is not more than 5 calories. So let's say we're going to put 2 cups of salad. That is 10 calories. So for your lunch, you are left, for your lunch, you've consumed, or you've spent 560 calories or 67 calories. You understand? So If you add up to the calories of your breakfast, you get around 900 calories. So for your dinner, you are left with only 300 calories, and you decide to take salad. It's good to know that salad calories are very, very low, and they help to make you full because of high content of fiber. You can decide to take 4 cups of salad, 5 cups of salad. You may not even exhaust the 300 calories that is left only when you have heavy dressing on your salad. So this is just an example of how you distribute your meals to get that 1,200 calories per day. If you do this consistently for 1 week, it's going to translate to reduction in 7,000 calories across that week. And when you weigh yourself, you definitely see a loss of 1 kg from your weighing scale. So this is when you decide to go calorie estimation method to take care of your diet. It's the most accurate, but it's a bit hard. So you get to understand or learn it with practice over time. So the easiest way of taking care of your diet is using portion control. From the word portion control, you reduce your portion, because if you are adding weight or you are not losing, if you are adding weight, it simply means that you are taking the portion above your body requirement. So what you need to lose the weight is just for you to reduce your portion. You understand? If you are not adding weight, you are maintaining your weight. It simply means the portion of food you are taking, it's enough. It's in accordance to your body requirements. So you are not going to lose weight, you are not going to add weight. Then if you want to lose weight, or if you are losing weight, you don't know the reason why you are losing weight, if you don't have any health issue, that means the portion of food you are eating is below what your body needs. So to use portion control, the first step is to change the size of the plate you use, because the size of the plate determines the portion of food you eat. If you are using a small portion, a small size of plate, let's say maybe 8 inches, and someone is using 12 inches, if you the portion of the food that will be in the two plates will differ, because sometimes when you serve food in a small plate, because of how full the plate will look, you will tell your mind will tell you that this food is much. And same as if you serve a small the same portion of food you use in your small plate, if you turn it into a larger plate, by me looking at it, you'll be thinking that this food is small, it won't be enough. You understand? Your mind will tell you that. So sometimes we don't. Your mind don't differentiate between the fact and myths. You understand? Something that is real and something that is not real. So the first step to do portion control is to change the size of your plate and the cup you use in eating or drinking, or for your client. You understand? So is it only changing the size that matters? No, even the combination of what you would take into the plate, the food must be balanced. Not only portion, it must be balanced. How will you balance it? Is by using an imaginary line on your plate. You divide the plate into 2 equal parts. So one part you you fill it up with your vegetables of choice, whether salad, whether lettuce, whether cabbage, whether spinach, ugu, water leaf, or cucumbers and tomato, any vegetable you want, you fill it up the half of the plate. Then the remaining half, you divide it into two. Half, you fill it up with carbohydrates. I know you all know what carbohydrates are. Then the remaining half, you fill it up with lean proteins, healthy proteins. You understand? It's just the same thing as saying you divide your plate into, you assume your plate is 100%. 45% of the plate, you fill it up with your vegetables, 5% with fruit, 25% with protein, and 25% with what? With carbohydrates. So this is a way of controlling your diet using portion control. Then after that, we now move ahead to talk about exercise. Yes, you have to emphasize your client, emphasize the benefit of exercise to your client. And the best form of exercise that help you to lose weight is combination of two: cardiovascular exercises and what strengthening exercises. Both help, combination of each have a unique benefit in comparison to the other, but combination of the two will give you the best form of exercise you need to lose weight. And in addition to what we've just finished explaining, I added that not only your diet and exercise, you have to take what? Enough water. You should take nothing less than 2 liters of water per day, because from your physiology, it is meant to understand that there are various processes in the body that we lose water. You understand? Like sweating, while talking, during respiration, urination, and so on. So from researches, it is meant that you lose about above 2 liters of water daily from these natural processes that take place in your body. And sometimes the amount you lose depend on even the weather and your physical activity level. So if you lose this amount, it is very important for you to replace it or replace it in your body, because if you're not fond of hydrating yourself well, a lot of physiological process will not happen the way it's supposed to take place in your body, and that will not help with your weight loss. Another benefit of water in weight loss, hydrating well in weight loss, is that sometimes your body confuse hunger with thirst. Sometimes you may be feeling hungry and you are not really hungry. You don't really need food. What you need is water. So if you should take water and exercise patience, wait for like 15 minutes. If you don't feel that hunger pang, then that means you're not hungry. You are simply thirsty. So water is very, very essential in healthy living or healthy weight loss. Another thing is water is a natural appetite suppressant. So it helps to suppress your appetite. So in addition to your diet, healthy diet and exercise, you need to adequately hydrate yourself daily. If you want to measure 2 liters of water, you can use sachet water, pure water, 50 cl pure water. 4 of it is amounting to 2 liters. So you should take nothing less than that. If you're using bottled water, 75 cl, for example, you should take nothing less than 3 bottled water, but you can take above that, depending on your need. Another thing that is very important in this weight loss is what? Sleep. Quality night sleep. Sleep is very, very essential, because when you have enough quality night sleep, you are going to get enough leptin. This leptin is termed our what? Weight loss hormone. You understand? It is our weight loss hormone. Why ghrelin is our what? Appetite stimulant. It's a hormone that stimulates our appetite, while leptin suppresses our appetite. And you usually get enough doses when you have quality night sleep. That is when the secretions is at peak. So when you have quality night sleep, the following day you are not going to be feeling you are not going to have increased cravings or super appetite. So if you don't have increased cravings or super appetite, it simply means that you are not going to eat above your body requirement. You won't eat much, so you are not going to be adding weight. It will help you to control your weight. While on the other hand, if you don't have enough quality night sleep, ghrelin level, your next day ghrelin level will be increased, and in addition to that, your cortisol level will be high, because it's our stress hormone. And another thing you need to know, this cortisol not only take care of your stress, it's what it feeds your fat cells. It's one of the food that your fat cells feeds on, and you have a lot of fat cells around your abdomen. So when you don't have enough quality night sleep, you have super appetite in addition to protruding abdomen. So to get weight loss, to lose weight in a healthy way, you have to combine this 4 components I've explained. Then we now move on to discuss about obesity and cognitive behavioral therapy, where we said obesity is a complex health condition characterized by an excess amount of body fat, which can have serious implication on our health. Then we'll now further discuss what cognitive behavioral therapy for obesity is, which is our main discussion. The reason why we explain the weight loss is it will help you in understanding cognitive behavioral therapy more. So this cognitive behavioral therapy for obesity, that is CBTOB, is a personalized approach to weight loss in which a form of psychotherapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to weight gain and obesity. That was why we discussed about mindsets. Yes, there are psychological aspects of weight loss that need to be addressed. Almost all your clients or anybody with weight, he or she, if you would talk to that person, you'll find out that he or she has negative thought patterns in association to his or her weight. You understand, that person weight. Maybe the person will not, definitely self-confidence and self-esteem will be reduced. And in addition to that, you'll be telling yourself, I'm not worthy, I'm not good enough, I'm not presentable, I can't lose this weight, I can't lose this weight because it's hereditary. I've tried and I didn't get it. All these things need to be addressed, because if these things are not addressed, you will not get sustainable weight loss. You can lose the weight, but the weight will not be the weight loss will not be sustained. You may end up regaining back the weight. You understand? So you have to take care of the psychological aspect of weight loss. And that is where cognitive behavioral therapy comes into play. You understand? Our traditional method of weight loss will help you to lose the weight, but it will be very difficult for you to maintain that weight. But this cognitive behavioral therapy is a program that is structured in such a way that you don't only lose the weight, you maintain it. And we talk about last week, we're able to understand that this this cognitive behavioral therapy is usually carried out whether in a hospital, private practice office or clinic, community health centers, online therapy clinics, weight loss clinic, or any suitable place for carrying out the program, because it involves series of visits to the particular place designed for that. So it's not something that you do at home. It's best done when you have a secluded area for that purpose. And we're meant to understand that it is made up of phases. We have the preparatory phase where we discussed it in details last time, and we have the phase 1 of the program, and we have the phase 2 of the program. And the whole program lasts for about 1 month, 1 year, 6 months, the whole program. So it's not just something that you just do to the patient for a few weeks and you are tired, or the patient stop coming and you just allow the patient. You are not going to get results. Remember, the main aim is to get a sustainable weight loss, a weight loss that you sustain for life. So if it is not accompanied with behavioral change, there is no how you are going to get it. And that is why it takes a longer time than our normal way of coaching our client to lose weight. So we talk about the preparatory phase, and this phase is the phase that set the foundation for the whole program. What do we do? What did we discuss at the preparatory phase? We said this is where the assessment of everything is taking place. Remember, for you to know whether your client need to lose weight, there are certain assessments you are going to make. I've already explained some when we started. So at the preparatory phase, it's where all the assessment is done. Here, apart from the parameters you assess, you are going to assess the severity of obesity. Understand? And another aim of this preparatory phase is to engage the patient in the procedure, in the program. Because if the patient or the client is not actively involved, he or she may not comply. So, and at this preparatory phase is the phase of what? Education, where you inform the patient about the whole program. You tell the patient that or the client that this program is it's going to take 1 year 6 months, and tell him or her the reason for the time frame, so that you get a sustainable weight loss. If the client has been battling with weight loss, that client will tell you that, yes, I've lost the weight but I regain it back. Then you tell the client that it's because the behavioral change or behavioral transformation was not established when you did that weight loss program previously. That is why. So this cognitive behavioral therapy, before the end of the program, if you follow it the way it should be, it is believed that the transformation will be achieved. So, and I further explained that we have obesity assessment questionnaire, which will be shared, inshallah, at the end of the workshop, where you get all the information you need to ask the patient, all the information you need to get. And we'll further explain the practical application of the assessment you did. It will tell you whether the patient, the indication for weight loss, whether he or she is contraindicated, if he has any psychological problem, and it will tell you what to do next. That is to refer the patient to the psychiatric clinic for proper management before you now start your own management, so that you achieve result. And we further discuss the all you need to assess. You understand? There is a physical assessment, and you find it in the questionnaire. We talk of the psychological assessment. It's also there in the questionnaire. So we also further discuss what you need to let the patient know. Let him know what obesity is. What are the risk factors for this obesity? Tell or educate the client in an informative way, not terrorizing manner. Do not scare that client. After explaining all this to the client, tell him or her that the good part of it is that it is reversible. It's something that is reversible. And the moment you reverse it, all the risk factors will not be there. You understand? After that, you tell the patient that he or she will be going home with daily assignment, weekly assignment. Weekly assignment, and he or she need to adhere to that assignment and need to participate actively. And tell him or her that the cognitive behavioral therapy program, after this is the preparatory phase. After the preparatory phase, tell him that there is the that is spread across 24 weeks. You understand? 16 sessions spread across 24 weeks. Sorry, my network. I'm sorry, my network is fluctuating. So you tell the 16 sessions literally means visit to the hospital, 16 visit to the hospital, spread across 24 weeks. You understand? The 16 session, the first 8 session is 1 visit per week. Then the remaining 8 session is 1 visit in 2 weeks, making it 16 session and a total of 24 weeks, which is 6 months. That is the first phase. And tell the client that the first phase, usually that's where the weight loss take place. That is where the patient is educate the client on how to achieve the weight loss of 0.5 to 1 kg per week. And we're going to see all we need to implement in the first phase. Then you now tell the client that then from the first phase, then we'll move to the second phase. And the second phase is usually in the span of 1 year. That is 12 months with 1 visit in 4 weeks. So 12 a session, 12 visit, and 12 months, since it's 1 visit per month. And at the second phase, that is where all effort to lose weight is stopped. The calorie restriction is stopped. The exercise is maintained. You understand? So that you try to learn all the skills you need to maintain the weight you've lost. Yes. And that is why even the visit is what is extended to be what once in 4 weeks. So it's at the preparatory phase that you discuss all this to the client, and we've mentioned it the last time we did our we had our first session. So now we are going to move to what, to the first and second phase of cognitive behavioral therapy. So our next slide. So this is the phase 1. So as I've already mentioned, the preparatory phase set the ground or foundation for the whole process. You understand? It set the foundation for what? Starting the phase 1 of cognitive behavioral therapy. If your preparatory phase is not well done, you may not succeed at the phase 1 of the program. So this phase 1, the duration is 24 weeks. With what? 16 sessions spread across these 24 weeks, or 16 visits to the center. You understand? Each session is a visit, and the first 8 sessions is done once weekly. Then the remaining 8 that will add up to give us the 16 session of the phase is usually once in 2 weeks. You understand? When you add up 8 sessions once in a week, 8 sessions once in 2 weeks, it will give you 16 sessions. So this is the phase where what? The actual weight loss take place. And it's made up of what? 6 modules. The 6 modules include the first module. This is where there will be monitoring of food intake, physical activity, and monitoring of body weight. The second module contains, this is where changing eating habits is implemented. It is taught and implemented to the client, you understand? The third module addresses what? The what? Development of active lifestyle. This is where physical activity is gradually introduced to the client. Then the fourth modules include addressing obstacle to weight loss. Yes, there are obstacles to weight loss, and we've discussed about obstacle to weight loss previously in the last session that we had last week. So, but we still discuss about it. So the fifth module is going to address weight loss dissatisfaction. And the sixth module is going to address what? Obstacle to weight loss maintenance. All these that I've mentioned, the addressing obstacle to weight loss dissatisfaction, and weight loss maintenance, obstacle to weight loss maintenance, will all have questionnaires that we use in addressing all these I've mentioned. So from the modules, these are 6 modules. And I've said that the phase 1 lasts for 24 weeks. So that means the 24 weeks will be spread across these 6 modules. You understand? There is no distinctive point, or there is no distinction that, or there's no specification of how many sections can be done in each module. You understand? We have 16 sessions spread across 6 modules. So there is no any there's no any specific week or specific section that you must spend in a particular module. Your stay in a module, or the length of time you spend in a module, depend on your client how he or she learned, how fast he or she learned, or how fast he or she adapt to the changes you are trying to introduce. This program is meant to be gradual. You introduce one thing at a time. You understand? It is one step at a time. If you rush your client, the client may not comply and you may not get result. So now let's see what happened in each module. The next slide. Module 1. This is where we talk of monitoring food intake, physical activity, and body weight. How? How do you monitor food intake? How do you monitor physical activity? And how do you monitor what? Body weight. So what we use in measuring it, there is a form. The form is called the food and physical activity monitoring form. I'm going to share it with you after the class. You understand? That's the first visit, the first session of phase 1. When the client visit the hospital, you've already explained the procedure during the preparatory phase. So when he visit the hospital, you try and re-explain the treatment, the whole treatment section to your client, what it involves, the sessions, yes, the modules. Tell him about the modules in the way he or she will understand. Do not use big terms that will be very difficult for your client to comprehend. So come to the level of that particular client. You understand? Explain all the modules to him or her. Then explain the sessions to the client. Before starting monitoring the food intake, he or she need to understand what energy system is. Explain energy system, because that is when he will understand that, oh, so the amount of food I eat affects my weight. You understand? That is when he will come to understand. And sometimes when you don't understand why you are asked to do a particular thing, you sometimes you will not even do it. You feel reluctant in even complying. So it's very important you explain the energy system to your client in the way he or she will understand. You understand? We've already explained that. It's there in the previous session that we had. Then the next thing is what? Establishing the real-time monitoring of food intake and physical activity using a form. And I'm going to share the form with you at the end of this class. And the form, what is inside that form is what? The day. So the day of the first session, you are going to write the date. Then the calorie goal. How many calories you want the client to be taking on a daily basis? You understand? How many calories you want the client to be taking on a daily basis? Then the form include columns. There is column for energy intake. That energy intake is divided into the time. You have to state each time you take a particular meal or a particular snack. Then there is column for food and drink you consume. Remember, this is after you've already finished explaining a calorie estimation to the client, the ones that you've already explained. And you need to even provide the client with calories of the commonest food the clients do take. So to make it easier for you is for you to do a tracking first during the preparatory phase. You understand? Since after the preparatory phase, the client will come back after a week for the first session. You understand? So what you will do is, during that period of 1 week before the start of the first session of phase 1, give your client an assignment. The assignment is simply tracking of the food he or she eats. Tell the client to, if it is, yes, even if it is physical, since you are not together with the client, tell the client to take a screenshot of each food he or she eats throughout the day and send it to you. You can do this tracking for 3 days. You understand? Then note how many liters of water he or she take for the 3 days. Know the his physical activity level. And what we normally use to track this activity level is as an app called pedometer or step tracker. Sorry, I did not include it in my slide. you need an app called pedometer or step tracker to track the activity level of that your particular client. So the assignment you are going to give him or her is tell him or her to what? To note, to take a record of the food he eats for 3 days. He shouldn't change the portion of food he eat. He shouldn't change the combination of food he eat. He shouldn't change the frequency of his eating, how often he eats in a day. He should just screenshot it and snap it and send it to you. Likewise, his hydration. How many liters of water do you take daily? He should be able to tell you for the 3 days. Another thing is the activity level. That is when you use the app pedometer or step tracker. And usually you find it on your Android phones or even iPhones. You understand? You go to Play Store, download the pedometer or step tracker. There are the free versions and there are the paid versions. So I usually tell my client to use the free version because it does what we need to know. So when you download the app, it's going to ask you to input your weight, height, your age, your target goals per day. So he or she will input all the parameters that is being asked. Then you set it. After setting it, as he move around with the phone is going to take to record each step he or she takes. So at the end of the day, he should screenshot the steps and send it to you. Is it 2,000 steps? Is it 3,000 steps? Is it 4,000 steps a day? Let you know, because that will be the basis of what? Treating your client, progressing your client. Because if you don't know the level, he or she, his activity level, the amount of food he or she eats, if at once you restrict the diet of that particular client, or you ask him or he to take a longer step that he is used to, it may lead to problem. Yes, it may lead to even the patient not able to comply because he or she may be in pain. You understand? So having known so the first visit, when the client visits you, he is expected to bring the assignment you gave him or her during the preparatory phase. You understand? So from the phase, from that assignment he gave you, you are going to explain what energy balance is to that patient. And you tell the client, okay, from what you've given me, it simply means that you are taking above your body requirement. You can even do rough estimate. Sometimes when we do this tracking and when we are estimating the calories of the tracking, the assessment we did, you find out that a particular client will consume about 6,000 calories in a day. And his output will not be more than 200 calories. So please, why won't that client be adding weight? Do you understand? Sometimes when we do this tracking, when we are translating it, we find out that that client is consuming above his body requirement. Sometimes within 2 days, that client can consume 7,000 surplus instead of 7,000 shortage. So sometimes they will be telling you, in a week, sometimes I do add 2 kg. Sometimes in a week, I'll find out I've added like 3 kgs. When he or she is not aware of the energy system, that client will be eating carelessly. So you are going to use the assignment you gave him to explain what this energy balance, what the energy system is. You understand? So after the next thing is what? You now give him or her the form for what? For monitoring the food intake and what? The physical activity level. I've already started in the form, the date, there is a space for date. That client must write the date. That is your first session. Then from your findings and what you agree with the client, you what? Your calorie goal. This daily calorie goal is not going to be unique throughout the sessions. It will change. Maybe after your calculation, what he or she needs to be consuming is 1,200 calories a day. And the client is already used to 4,000 calories a day. So the first thing you will do is to reduce the calories to 2,500 calories, not from 4,000 calories to 1,200 calories. If you should do that, your patient can even faint, or he will be having symptoms that like dizziness, serious head pain, headache, you understand, weakness, generalized body weakness that will scare him to even comply with the program. So your first calorie that you will tell the client to start taking is not your target calories. You have your target calories. So you are going to push the patient gradually till that patient reach the target calories you want. And explain to the patient that you know that you are already used to giving your body so calories, 4,000 calories. It is not wise or it is not healthy to reduce the calories at once to our own target, that's 1,200 calories. So what we are going to do, we are going to do gradual reduction. From these 4,000 calories that you are used to, we are going to go to what? 2,500 calories. Then you help to educate the patient. You can ask the patient, what are your options of breakfast? What do you like taking for breakfast? What do you like taking for lunch? What do you like taking for dinner? How many meals do you take per day? So from there, you will now advise the patient, giving him the documents containing calories of the common food he or she eats. If that client is literate, you can even tell him, if you check this calorie and you are not seeing the calories of the food you intend to eat that day, you can browse to get the calories. You understand? And if it's difficult for the client to estimate his or her calories, what you will do, you estimate it for him. Tell him, okay, if you are used to taking tea and bread, how many slices of bread do you take per day? Okay, I take 10 slices. Okay, we are going to reduce it to 5 slices. You understand? And if you take it, make sure you write in the column containing food and drink consumed, you are going to write everything you eat. You should not skip anything. You understand? So the form, there is a column for food and drink consumed. You tell your client that you are going, anything you eat, you put it down on in the column of food and drink consumed. And don't forget to write the timing since there is time. Then the next column is for calories of each food he consumed. If the client is someone that can do that without any difficulty, you allow him or her to do the estimation of the calories. If the client said, Kai, I cannot do this, no problem. Just tell me what you've eaten, the quantity. Use the measuring cups. There is one measuring cups used by bakers. I will send the pictures for you to see. I'm very sure the ladies among us know are familiar with the cups. It's usually used in the kitchen to measure things, you understand? So that is the cup you use in estimating, because it's the easiest way for someone to implement. So you tell him, okay, what I want is that if you take 1 cup of rice as lunch, write 1 cup of rice for me. If it is jollof rice, write 1 cup of jollof rice. If it is 2 cups, write 3 cups of jollof rice. You understand? So if you want, if from what you find out from the assignment you give him during the preparatory phase, he is used to taking 4 cups of jollof rice as lunch. Then our intention is to do gradual reduction. So what you do, you tell him, okay, you see that measuring cup I talked to you about, I want you to be taking 2 cups. Since you are used to 4 cups, let's reduce it to 2 cups. So if you reduce it to 2 cups, we are going to add up vegetables so that you will feel full. Because most at times, those that do add weight or are obese, most of them are not friendly with vegetables. So you need to educate him or her about the importance of vegetable. So you are the one that will tell her or him what to be taking, the quantity based on that cup. If he or she cannot do the calorie estimation, you understand? Then there is a column that there is asterisk there. That asterisk tell the client that wherever you felt you binge eat or you overeat, please state it down. You understand? If during my breakfast I overate, write you overate. Then there is a place for comments and context. Where you wrote you overate, You have to tell us why do you feel you overeat that very time? It's because when I ate with my friend, or I ate with my sister, or I ate with my spouse, or I ate with my children, or while I was eating, I was watching TV, or I was pressing my phone. So after I finished eating it, I was not satisfied. So I went back and add. You understand? Or no, it's because I was the one that starved myself. Definitely, if he felt he overate, he's going to tell you the reason. And knowing the reason is very important, because it will help you to what? Prevent the overeating another time based on that reason. You understand? And there is also a column for place. That client should tell you where he eat the food. Is it in the kitchen? Is it in his sitting room? Is it in the dining area? Is it in his bedroom on his bed? Is it inside the car while he was going to school or work, or his working place? The place also sometimes play a role in the quantity of food you eat. For example, someone that eats in the kitchen, the food is there. You've already put the portion you are advised to eat, and you finish eating. Your mouth is not satisfied, and you are seeing the pot of food in front of you. Nothing will make you to not to add. So even the place that person eats food determines determines the compliance to the portion you advise him or her to eat. You understand? So you are going to see everything in the monitoring form. So after that, there is a column where you calculate the energy expenditure. You are the one that will do that calculation for the client. So there is a column where they wrote steps. You are going to write the number of steps each day. You tell the client, he's the one that will fill the form for you, but you are going to do the calculations. So the number of steps, you write the number of steps. And there is a formula for calculating the calories in each step. So if he was able to get 5,000 steps on Monday, there is a formula that you convert those 5,000 steps to calories. You understand? So if there is any form of formal exercise he carried out, write it down. You understand? Is it dance? Is it yoga? Is it Zumba dance? Is it high intensity interval training? He's going to write it down. There is also in the form I'm going to give you, there is where you get the calories of each form of formal exercise. You understand? Depending on what? Depending on the time. So after he has written all this for you, you are the one that will estimate the calories. Because sometimes when you allow your client to estimate the calories, they do overestimate, for example, or underestimate. Someone will eat 2,000 calories, but he will end up writing 1,200 calories. You understand? So just tell him or her to do the recordings for you. Then you are going to estimate the calories. So after writing all this, after you've gotten the form, there's a formula that is used to calculate the what? Daily energy intake and the what? Daily energy expenditure, which contains the three components I've explained. That is the resting energy expenditure, the thermic effect of food, and the activity energy expenditure to get your energy balance. So after computing all your information in the formula, at the end of the day, if you do the calculation, you are going to see how many calories was he able to reduce, since we want him to reduce the calories in order to achieve the weight loss. So after the calculation, the client will be there when you do your calculations, so that you will discuss everything with him. If you are able to achieve the significant reduction in the calories, then that clients will know, so this is what I need to do to be reducing my calories. You understand? So that is why beneath establishing the real-time monitoring food, we discuss about it. You tell the patient he or she will achieve better weight loss results. Because when you just assume, you are not going to get the real thing. You understand? That is the importance of the monitoring. Then you further tell the client it promotes more accurate control of portion sizes. Yes, because the calories is there. If you tell, okay, take 2 cups, because Tell him a cup is so calories. So if you take 4 cups, how many calories are you taking? That knowing the calories of the food he or she is taking will what make him to what better stick to the portion he needs to take, and that will help us to get the real portion sizes we need. The next slide. The next slide. Hello, sir. The next slide. So the next is explaining what the treatment will involve. So we've already discussed how you will do that. You understand? Then educating them on energy balance, we've done that. So the next slide. Hello, sir. Let's move to the next slide. Excellent. So still we are under what? Module 1. We are still discussing module 1. And our main concern in module 1 is food, physical activity, and the weight. So we've seen how we track the food and the physical activity. If you choose, get the form, you understand it better. The next is you have to what? Start initiating weekly weighing. You understand? What I've explained, if it is too much for your client to comprehend in one session, please divide it. Divide it into 2. Maybe you do it across 2 weeks or 3 weeks. You understand? So the next thing you will do is you have to initiate weekly weighing. Maybe after 2 sessions of his visit or her visit, then you tell him or her, we are going to be weighing weekly. You understand? We are going to be weighing you weekly at the center, not at home. So if he or she comes, the first thing you do is for you to weigh the client. You understand? And the best way to weigh a client is when he or she is on an empty stomach. And make sure he or she is not wearing anything that is carrying weight externally, maybe like wristwatch, or he or she is not holding a phone, handbags, because all this we add to the weight of the client. You understand? So explain to him the reason for this weighing is that it's help us to what? See changes in our weight. Because different food, we have different food, and your body reacts differently to different food you eat. Yes, we have carbohydrate as a class of food, protein, fat, vegetables. Sometimes a particular person's body will better lose weight while eating simple carbohydrates coupled with vegetables than eating complex carbohydrate. Sometimes when you eat starchy vegetables like sweet potatoes, Irish potatoes, sometimes it makes you to better lose weight than taking rice, taking swallows, even if the calories are maintained. So the importance of this weekly weighing is first to know whether you are making progress. Secondly, to know which foods your body better better work with. You understand? Since in that your monitoring form, everything you eat is there. If it is rice, 1 cup of rice. It is 1 cup of swallow. It is written there. If it is 2 cups of Irish potato, it is written there. So sometimes what you eat in your first week may be different from what you eat in your second week, and it may affect what? The weight. So if you are weighing weekly, any week that despite the reduction in the calories, but that client still did not lose weight, then there is need to cross-check. There is need for concern. You understand? It's simply showing you that it's telling you that this particular client's body don't work well with so-so combination of food. It works better with so-so combination of food. You understand? Or sometimes in a week, when you take varieties of food, maybe on Monday, you took rice as lunch, Tuesday, you took swallow, Wednesday, you took porridge, yam porridge, Thursday, you took beans porridge for lunch. You see, the food, you are varying what you are eating daily. The food differs. Sometimes when you eat a lot of varieties, you may end up not even getting that 1 kg off. Or sometimes when you vary the food, when you eat, let's say a week, maybe it's just two type of lunch you've been taking. Maybe Mondays to Wednesdays, you were just taking jollof rice, you understand, for lunch for 4 days. Then the remaining 3 days, you took Irish potatoes porridge. You may even lose 2 kg instead of that 1 kg. You understand? So that weekly weighing is very, very important. Then, what is the procedure? How do you do it? Yes, how do you do it? You should, client privacy is very, very, very important. We normally advise a client to be using light clothing while if he or she want to weigh herself. Sometimes, even if there are people in that unit, if you want to weigh your client, please do not make it public. Do not make everyone to know. It is between you and your client. You understand? So just the client should weigh, the weight of the client should be between you and him. Do not weigh the client in the front of even your colleague, because sometimes people knowing your client's weight may sound not comfortable for the client. You understand? So you educate the patient for the need of weighing and why you are weighing. Then you now proceed to the weighing. Make sure he or she is not putting anything that will interfere with the weight. And if possible, tell the client not to eat before coming, because sometimes on an empty stomach, you get the best weight or the real weight for that particular client. Then after the weekly weighing, let's move to the next slide. Let's move to the next slide. Yes, you can even, from the results of your weighing, you understand, the result of the weight reduction in weight you are getting, you can even plot a graph, a weight loss graph. And that graph will tell you, is the weight loss normal? If it is not normal at a point, maybe there is too much weight loss at that particular point, or there is no weight loss, there is even increase in weight, there is increase in weight, that is, there is weight gain, because these are things that you come across along the journey. It is not a smooth journey that it's compulsory that every week you must lose that weight. Sometimes, due to some reasons that you'll find out from the recordings that your client is bringing weekly, sometimes you may find out that your client did not lose weight because of so reason. Sometimes you may even find out that my client even increased instead of reducing. Maybe you started at 80 kg, then along the way he lost 5 kg. Then one day he just came after weighing, your client added 1 kg instead of even losing 1 kg. You understand? From the graph you plotted, you are going to see the pattern of the weight loss. And that will what literally interpret to what something that will make you to help the client adjust, change a particular food that he or she likes eating, or even change the method of his of the food preparation. So let's move to the next slide. Let's move to the next slide. So now, still in our module 1. Remember, module 1 is part of phase 1 of the program. And the phase 1 is made up of what? 24 weeks. So this module 1 that we're still discussing, for some might be in their 3rd session, for some their 2nd session, for 4th session. I'm still emphasizing there is no specific weeks you are to spend in a particular module. It depends on the compliance of your client, and you don't need to rush your client. It should be gradual, one step at a time. You understand? So still module 1, review records and other house homework. You understand? Remember the form I talked to you about, you are going to give that particular client weekly if he or she is going after his visit. And that form, for each week, you are going to give him 7 forms, because the form is for daily record, just like a journal, a diary, a food physical activity diary. So each visit you are going to give him for the number of days he is to come back. For example, if you are within that 8 session once weekly, you are going to be giving him 7 forms while he's going home. You understand? And if he's coming back, he's coming along with the field forms that you are going to review. You understand? And I've told you, what are you going to review? You are going to review to see whether is he accurate in what he's documenting? Is he documenting every episode of food and drinks he consumed? Is he writing the time? You understand? Is there any episode of binge eating? If there's any episode of overeating or binge eating, why? Where did it take place? Is it in the kitchen? What was his comment? You understand? Then from there, you are going to educate the patient. As you move along, you understand, you are going to educate the patient based on the findings of his assignment. If you find out that he binge eats because of the place he eats the food, then you're going to tell him to find a better place where he'll be eating food. That place he always binge eat while he says is not suitable for eating. You understand? So you move ahead the process of recording. That is the timing. You understand? Sometimes they will write the importance of the timing is for you to know the interval between one meal and the next. Or snacking. Is there episode of snacking in between? At most, the ideal hours to be between one meal to another is between 3 to 4 hours. So if you should see that he took his breakfast around 8 a.m., then around 11 a.m., he took another meal, then there is reason for concern. There is need for you to ask him, why you just ate your breakfast around 8 a.m.? What happened? You took another meal around 11 a.m. He will tell you, I saw my friends eating. It was in the office and they brought food. I was unable to resist. So I ate together with them. Or no, I was craving meat pie and my friend brought one, so I ate. You understand? That eating is not necessary. So you are to educate your client on that particular, is not ideal for you to eat that time. You understand? Next time, when things like this happened, leave the place. If your colleagues eat around 11 a.m. and you've already eaten your breakfast at home, when they're about to eat, leave the office. Or if your friend should give you a meat pie and you've already eaten your breakfast, it's not time for you to eat another meal. You either reject it or you keep it to eat so that you eat it on your next time. You understand? Your next meal, then you use that meat pie for your next meal. You understand? So that is the importance of the timing. Then the recording. Let's move to the next slide. So still we are done with our module 1. So I'm very sure we can recall what we discussed in our module 1. Our main concern at in level 1 is what? To monitor food intake. That is number 1. Secondly, to what? Monitor physical activity level. The third thing is what? Monitor weight. You understand? And we've seen how we can do all this. We've seen how we can do all this. So in your module 2 is what? Changing eating pattern. You understand? That is where you what? Start changing eating pattern. And it is stated that it starts in session 2, not necessarily in session 2. Session 2 translates to week 2 of your phase 1 of the cognitive behavioral therapy program. So it depends. For some, maybe this will start in your what? Session 4. You understand? Week 4 of phase 1, depending on the compliance of your patient, depending on how fast your patient progress. That is what determines the session. So you shouldn't ignore it start in session 2. It can, for some that are very fast, it can start in session 2. For some, it can even extend to what? Session 4. So this is where you what? Start changing eating to create a moderate energy deficit. Are you getting me? I told you, if from your assessment, you found out that this your particular client is taking 6,000 calories daily, and he needs to take 1,200 calories daily, you understand? You are not going to at once tell the client from today, you are going to be taking 1,200 calories. No, no, no. It's going to be a gradual process, one step at a time. You understand? You may decide to reduce 1,000 calories from that 6,000 calories he takes, depending on how he loves food. You understand? For some, they can tell you, okay, no problem. You can even reduce 2,000 calories. Since they are already aware from what you educate them, they already know what calories are. For some, someone will take, Kai, if you reduce 2,000, am I sure? Are you sure I'm going to comply? So it depends on your client, but it's at the module 2 of this phase that you start changing eating pattern of the client or creating calorie deficit. You understand? And you are not just going to tell the patient, do this. No, educate the patient. Let the patient be aware. If the patient is aware, it's very, very easy for him to comply. You understand? If he's aware, it's very easy for him to comply. Because if he's not aware, he will not, sometimes they will not tell you the truth. He will just go and be doing what he is used to without knowing the implication. But if he's aware that what you take in is what translates on your weight, he is going to comply. You understand? So then this is where you tell the client, okay, the aim at this phase is for us to create a way in which you will lose 0.5 to 1 kg per week. And you explain, for you to achieve that, you have to create 7,000 calorie deficit. As I've already explained, you understand? If it is 7,000 calorie deficit in a week, that means daily you are going to create 1,000 calorie deficit. You understand? Then you tell the client that if you abide by this, you are not too extreme, it's going to translate into healthy weight loss. What is healthy weight loss? 75% will be that of fat. You understand? So the majority of the weight loss will be from your fat. Even if your muscles will be affected, it will be very little and it will not be significant. You understand? But if you over-restrict your client, your food, you are not going to get results. Tell the client, because some clients, they'll overdo it. This is what you ask them to do. But they will feel that, I can even do more than this. You understand? I can more than this. 1,200 calories to lose 1 kg. I mean, I can even eat 600 calories. Some do overdo it. But if they are aware of the implication of over-restricting the diet, they are going to follow what you ask them to do. So let's move on to the next slide. you will find out that most at times, as I've already said earlier on, that the diet composition matters. You understand? Though there are researches that will tell you, there are certain school of thought that will tell you that provided you create the calorie deficit, you reduce the food, the composition of food is not a priority, or it will not matter to us. This is wrong. The composition of food matters. The food must be balanced diet. It must be healthy. It must contain all the classes of food in the right proportion. That is why we were introduced to what balanced meals before the session. That is why we talk about the composition of a healthy meal. That is, you just use an imaginary line to divide your plate into two, half filled up with vegetables, quarter of the plate carbohydrate, quarter of the plate proteins. You understand? This combination will provide the body with the right nutrients. So it's one thing to lose weight and be healthy, and it's another thing to lose weight and be unhealthy. I'm very sure you've come across scenarios whereby someone will lose weight, but the person will be looking sick. And scenarios whereby someone will lose weight, but he or she will be looking fine, more handsome, or more beautiful. You understand? This is because you've given your body, you've nourished your body well. You've given your body all it needs. So the composition of the plate or the food you'll be eating matters. You understand? So educate is a module 2, where you start changing the eating habit of the client. And this eating habit include the combination of the food he eats. It also include the method of preparing the food, because sometimes a particular food might be healthy, but the way you prepare it will render it to be unhealthy. Any food that is deep fried in oil, it's what? Unhealthy. Any food with a lot of salt or seasoning, it is what? Unhealthy. Any food with a lot of sugar in it, it is what? Unhealthy. Any food with added fat, it is what? Unhealthy. So it is during this module that you will be what? Gradually educating your client on it. And as you gradually educate your client about it, voluntarily, intentionally, that client will what? Stop or try replacing the unhealthy food with healthy ones. So let's move to the next slide. So there is an argument about very low carbohydrate food versus what? A very high carbohydrate food and what? Low carbohydrate diet. There are different approach to weight loss that people use, you understand? There is the one that they only eat fats. So it's what? Zero carbohydrate diet. There is no carbohydrate. That is ketogenic method of losing weight. You understand? They only eat fats because they believe that, not even they believe, from researches, it is shown that when you eat only fat, you are going to push your body into ketosis. And that will what? Make fat loss from your body very fast. The fat, your body will be losing fat very, very fast, at a faster rate than when you eat all the food in the right proportion. But it has a downside, yes, because when you eat too much protein food, you may be at high risk of developing kidney issues. You understand? And sometimes some of them will even come up with high uric acid. You understand? Some will come with gouty arthritis. So that is why it's not advisable to what? To only to delete or omit a particular diet, a particular class of food from your diet, and only concentrate on one. You understand? So it's very important to balance all. Let it be that you take healthy carbohydrates, which are the complex carbohydrates. Take lean proteins, which are the healthy proteins, and take a lot of vegetables and moderate fruits. Let's move to the next slide. Let's move to the next slide. Excellent. So remember, what is the aim of this module 2? Is what? Changing eating pattern. So when you want to change the eating pattern of your client, you should do it in such a way that it will increase adherence to the diet. How? What can you do? What can you do for to help your client to adhere to the diet you want him or her to be taking? First thing is client preference. You know, we have different example of carbohydrate. We have rice, we have pastas, we have swallows, we have potatoes, we have yams, we have tubers in general. All these are what? Categories of carbohydrate or examples of carbohydrate. Not everyone is unique to what he prefer. Even in your house, I'm very sure, maybe when your mom cook rice, or if your wife, or if you cook rice, you tend to eat more because that is what you want. Maybe your daughter prefer pastas. Another person in your among the family members prefer tubers. So your client, it should be in accordance to what your client prefer. Ask your client, in terms of carbohydrate, what are your best type of carbohydrate you like eating? Please advise him or her based on that. You understand? With regard to protein too, advise your client based on that. With regard to fat, the same thing. Vegetables, the same thing. This will what? Increase your client adherence to the what? Diet. You understand? That is where you talk of the diet structure. Because if what you ask the client to be taking is not according to his or her preference, he or she may not comply and you may not be getting result. Or the client might even refuse to eat, since what you ask him or her to eat is not what he likes, and that will lead to what? Over restriction. You understand? Here, where the talk of underestimation of calorie intake, that is what I explained during our filling of form. Sometimes when you ask someone to estimate calories of the food he or she eats, there is overestimation. You understand? There is overestimation. So it's best for you to do the calorie estimation for what? For the client. So here, if your client, from the indications of weight loss that we talk about and the contraindications, there are indications that this particular client need to lose weight. And there is indication that he don't need to lose weight, but he needs to eat healthy. Yes, you get a scenario whereby your patient need to adjust his or her diet and be active. Just, in short, your client need to lead a healthy lifestyle. He or she don't need to lose weight, only to lead a healthy lifestyle. So what do you need to do? If you want to reduce that your patient's, that your client's calories, for obese individual, where you need to do the calorie deficit, calorie estimation very well, it should be a reduction of 30 to 50% at the initiation. You understand? At the beginning. Then for people with normal weight, there is need, if it's within normal weight, maybe that client is 24.9, BMI 24.9. There is need for that client to reduce a little weight so that he or she will not easily fall to the overweight or obese category. You understand? So when you are estimating, when they are estimating their calories, they may be wrong. You understand? They can eat 2,000 calories a day and they will end up calculating 1,200 calories. So that is why it is very essential for the clients to do the recording. Let them just record and they should bring it to you. So if they should bring it to you, you are going to better do the calculation better than them. Even if it is not exact, the error will be what? Minimized. Let's move to the next slide. So still under module 2, we are not specific about the session because it depends on your client. You understand the compliance of the client. Still under module 2, this is where still education on food, eating patterns, eating behaviors continues. You understand? You are not going to what? Stop the recording. You keep recording, daily recording, and weekly submission of homeworks. But what will you do? The education continues. You don't teach at once. You don't let them understand everything at once. If you say at a go, you are going to teach them everything, they may not what comprehend. So you keep the education. Tell the patient to what limit food variety of food. When you have variety of food that you eat, it's very, very difficult for you to what? To stick to the calories. It's very difficult for you to what? Stick to the calories. Because sometimes when you are fed up with a particular food, you don't eat much. You don't eat much. And I'm very sure everyone has experienced something like this. For example, you cook rice today, tomorrow rice. Even if you eat, you will not eat much because you ate it yesterday. You understand? You will not be eager to eat it again. But for example, today you cook rice, jollof rice. Tomorrow, you decide to eat beans porridge. Next tomorrow, you decide to eat swallow. Every day is a different food. So every day, your urge to eat that food is different. You understand? So you have to limit the variety of food you eat. Please try and explain this to your client. Limit the variety of food you eat. If you like, you can just decide to take 2 lunch or 3 type of lunch throughout a week. You understand? It will reduce the quantity of food you eat. And that is our ultimate goal, to create calorie deficit. In this module 2, this is where you teach your clients weighing of food. You understand? Weighing of food. It's either you use your food weighing scale. We have food weighing scale where you measure your food to know the grams of your food. If you know how many grams this particular food is, you can know the calorie of that food. Since we said, for example, if you check, if you browse, you're going to see that 100 grams of granite, it's giving you 524 calories, 28 to 24 calories. If you want to eat granite as snack and you just decide to weigh it, you understand, maybe you don't want to use measuring cup, you just decide to weigh it. If you weigh it, maybe 50 grams, the granite is 50 grams, and you already know that 100 grams of granite is 528 calories. To get 1 gram of granite, you divide 528 by 100. So you are going to know that 1 gram of granite is equivalent to what? To 5.24 calories. So if you've eaten 50 grams, to know the calories of that granite you've eaten, you will just what? Multiply 50 by 5.28. And that will be the calories of that 50 gram of granite you ate is. If you want to eat roasted corn, as your snack, you just weigh it. Know the grams of that corn you are eating, since they don't have uniform weight. Then when you browse, you are going to get a gram of 1 gram of roasted corn. Then you now multiply by the gram of corn you are taking. You understand? If it is swallow, maybe you decide to eat a semu. You understand? You can weigh the semo, the swallow, the portion you want to eat. You will know the gram you are taking. You understand? If you know the gram of your taking, you multiply by the gram, the value of 1 gram of that semo, then you will know the exact calorie you are taking. Sometimes even the food weighing estimates accurately more than the estimation with measuring cups, because sometimes you, depending on the food, the method of cooking, you can get to have more in a cup compared to another method of cooking. So you still emphasize to the client that we don't want over restriction of diet. No, we just want you to eat right. You understand? We are going to create a calorie deficit, but the one that will help you to lose weight in a healthy way, not the one that would compromise your nutritional level. You understand? Not the one that will lead to nutritional deficiency. So for ladies, it is from researches, it is shown that ladies should not go below 1,200 calories. Tell your patient times without number. Keep emphasizing to your client, because you reminding the client from time to time will make the client not to underestimate or over restrict their diet because they are in a haste to lose that weight. Remember, your client is not staying with you. He only comes for a visit. So he's going to go. It's what you are telling him that will make him to comply to all the rules and regulations you are giving him or her. And another thing you need to emphasize under changing eating habit is you should not eat 1 meal per day. You should not eat what? 1 meal per day. You should spread your meal, your food, your calories across your meal. Eating 1 meal per day is not healthy. At the long run, it will not give you a healthy weight loss, even if you are eating that particular calories that is your target. So depending on your preference, you can spread your meal across, spread your calories across 2 meals, 1 snack, or 3 meals, 2 snacks. Remember, the number of meals at times you take a meal or the number of snacks you take will not change the calorie content of all you eat in a day. You understand? If you decide to take 3 meals, 2 snacks per day, it should not exceed that 1,000. If it is 1,200 calories, it should not exceed that 1,200 calories in a day. You understand? Another information your patient, your client need to understand is educate him or her on the composition of food. We've already said that. Next is food with low glycemic index. We have food that have low glycemic index. Food with low glycemic index are weight loss friendly. You understand? And this food include complex carbohydrates. Food with low glycemic index are food that when eaten, they are not digested very fast. You know that there is an ideal speed of digestion that you need to be having in order to maintain your blood sugar level. If you eat simple carbohydrates, most simple carbohydrates have high glycemic index. So when you eat a simple carbohydrate without any vegetables, without any protein or fat attached to it, it will be easily, or it will be digested very fast in your body. And when there is a fast digestion, absorption, and release of the nutrient glucose, most especially, there will be sharp increase in your blood sugar level. And when there is sharp increase in blood sugar level, it will lead to increase in secretion of insulin. You understand? And when there is increased secretion of insulin, there will be abrupt clearance or yes, clearance of the glucose from the circulation to the store for storage. And when that occurs, you will be hungry. You will easily be hungry. You understand? So what we do is we advise clients to take food with low glycemic index, as the digestion is gradual, very slow, So not slow to cause problem. No, slow in such a way that there will be what? A gradual release of energy. So if there is gradual release of energy, it will not lead to what? Sharp release of insulin. So there will not be abrupt clearance of glucose from the blood. So if you eat food with low glycemic index, you will stay for a long period of time without being hungry. So if you really want to lose weight, or you want your client to comply, you try and advise him or her to include food with low glycemic index in his diet, which is complex carbohydrate. This complex carbohydrate include whole grains that are not ultra processed, whole wheat pastas, you understand? Any carbohydrate that is not ultra processed, it is what? A complex carbohydrate. Even our sweet potato, our Irish potatoes, all these are complex carbohydrate. We also have other grains, though they are not common everywhere. It's unique to some areas, some states in Nigeria, like the fonio. We call it acha in Hausa. It is a complex carbohydrate, like the tamba, that is finger millet. It's a complex, very complex carbohydrate which is nutrient dense. Usually, you normally find it around Jos. Yes, Jos. That is where you mostly get tamba, even Zaria. Tamba and that's finger millet and fonio. All these are complex carbohydrate. So this is even the basis for managing people with diabetic. You understand? What is the ultimate goal in people with diabetes is to control the blood sugar. So anything you will do to prevent sugar spike or insulin spike, that is your ultimate goal in managing someone with what? Diabetes. So that is why you advise them to take complex carbohydrate. This is not saying that you will not eat simple carbohydrate at all. That is, you will not eat your white rice, you will not eat your white pastas, you will not eat your white bread, you will not eat your semo. It's not saying so. If you must take your simple carbohydrate, you should couple it with what will reduce the glycemic index. And the things you usually couple it to that will reduce its glycemic index is what? Protein and fat and vegetables. You either couple it with healthy protein, healthy fat, or vegetables. These are the things that make a simple carbohydrate to have a low glycemic index. And another thing you emphasize to your client is the importance of protein. Protein is very, very essential because it has high, will I say, caloric burning capacity when you eat it in comparison to carbohydrate. When you eat a protein, your body need more energy to break it down compared to carbohydrate of the same gram or quantity. You understand? So if any food that need more, for example, let's say 20 gram of protein, you ate 20 gram of protein, and someone eats 20 gram of carbohydrates, the energy your body will use, the thermic effect of burning the protein, you understand? It's what? It's more than the thermic effect of burning the carbohydrates. So, and another thing is, when you eat enough protein, your muscles bulk is preserved. You understand? It is what? Preserve. And another thing again, it's what help to reduce appetite. So protein, adequate intake of protein is very, very important. So still emphasize about that 25% intake of protein at each meal or in the whole day. You understand? Recall the portioning, the imaginary percentage we create on our plate. So please try as much as you can to take that. Also, you should what? Tell them to limit fat intake, moderate fat or even limit fat intake. And when you are even taking the fat, take the healthy ones. When you educate a client that 1 gram of carbohydrate is 4 calories, 1 gram of protein is 4 calories, but 1 gram of fat is 9 calories. without you even emphasizing, that client will know the reason why everyone is emphasizing on limiting fat or moderating fat in your diet, because we cannot restrict fat from our diet. We can't remove fat completely from our diet because it has its own importance in our body, which we discussed during our last session. Another thing you need to tell your client is to more intentional about including vegetable, a lot of vegetable and moderate fruits in their diet. Advantage is that vegetable and fruit contains a lot of fiber, and when you take high fiber food, it tends to lower your or normalize your blood sugar, and again it's improve your gut bacteria, you understand. And another thing is it make you to stay long without being hungry. And another thing again, it is where you get major will I say supply of your minerals and vitamins, which are very, very essential in healthy living, you understand. And even fruits, emphasize on taking the whole fruits, not the juice. I'm not trying to say the juice is not healthy, but the whole fruit is more healthier than the fruit juice, even though it is natural. So let's move to the next slide. So this is what I've explained earlier on. That is dividing your plate into using imaginary lines into the percentage: 45% vegetable, 5 fruits, 25% whole grains, and 25% healthy proteins. Let's move to the next slide. So still under module 2 of phase 1 of cognitive behavioral therapy for obesity. And the aim here is changing eating habits. And we have been discussing on ways to change the eating habit in order to be in accordance to weight loss, in order so that what we are advising the client to, it should be supporting weight loss, not sabotaging our weight loss effort. So another thing is changing this eating habits will increase adherence to the meal plan. You understand? All what we've been explaining is what strategies. Because now, if you did not include food that will make you to stay full for a long period of time, you ask a particular client to keep taking simple carbohydrates, you understand, and the portion is reduced, he or she will not comply because he or she will be hungry. You understand? You've reduced the portion and you didn't even make it in such a way that it will sustain that particular client for a long period of time. That patient will not comply. He or she will not adhere to the meal plan. Another thing that helps with this adherence is try and advise client based on his financial status. You understand? We have cheap, affordable carbohydrates with low glycemic index, that is healthy carbohydrate. We have cheap sources of proteins that are healthy, fat, vegetables, all this we have as cheap sources, you understand, those that are affordable, and we have the expensive ones. If your client is of low to medium social economic status and maybe with low income, he's a low income earner, if you should prescribe or advise him to take expensive sources of this food I've mentioned, he is not going to comply. So there will not be what? There will not be adherence to the meal. You understand? If your client is rich, he or she is used to taking rich sources, expensive sources of carbohydrate and proteins. If you advise him to be taking cheap ones, he or she will not what? He will not comply. So there will not be what? Adherence to this meal plan. So another thing you need to address, still under module 2 of this phase 1 of cognitive behavioral therapy, part of what you'll be educating your client. So you can decide, is based on you. You can decide based on the how well the client is following, is progressing, is understanding. You can decide to sit down and define your sessions. Okay, module 1, I'm going to use a 4 session in educating and making my client to implement all we need to do under module 1. Then module 2, you can decide, okay, I'm going to take 4 session also, in order to make my client to what? To adhere to adhere to what I want him to implement. You understand? It depends on you and what? The client. So the next thing you need to teach your patient is planning ahead. Yes, planning your meals ahead. You've changed what to eat. You've known the healthier sources of all the classes of food. You've known the portion you need to be taking. You've known the how many meals you want to be taking per day. So the next thing you need to teach your client is planning ahead. If you plan your meals ahead, you're not going to have a problem of eating anything you come across. Yes. If you plan what to eat, you are going to make it available before time. You understand? If you did not plan what to eat, and maybe you are coming back from work, you are very, very hungry. You came in and you saw golden brown yam fried, you understand, with let's say with juice, with drinks, maybe any fizzy drinks, and you are very hungry. You cannot wait for preparation of a healthy meals. You have no option that to eat the golden yam. And you know golden yam is not healthy because it is deep fried in oil. Its calories, it's much. You understand? If 1 cup of boiled yam will give you 140 calories, when you fry it, it may give you 360 calories. It may triple its calories. So it's not healthy. You understand? Sometimes when you did not plan ahead, you can skip meals. If you skip meal, there is possibility of you overeating on the next meal. You understand what I'm saying? For example, you need to eat, you are used to eating 3 meals per day, and that is what you've decided. I can't eat less than 2 meals per day, so I'll be taking 3 meals per day. Then you've taken your breakfast, you went out maybe to work or any other places, you didn't plan for what to eat. You come back home, you didn't meet food, or you met unhealthy food that you don't want to eat. So if you refuse to eat and you now decide to prepare your healthy meal that you want to eat, if care is not taken, you are going to overeat, because you'll be telling yourself that I didn't eat lunch. I didn't eat lunch, so I need to eat lunch and dinner at the same time. So at long run, you are going to what? Overeat. You understand? You are going to what? Overeat. And if you overeat, it will be very difficult for you to create that calorie deficit we need for you to lose that weight we want. You understand? So you have to plan. When will I take my breakfast? When will I take my lunch? When will I take my dinner? You understand? What will I eat? Where will I eat it? You understand? This when to what to eat also, it's very, very important. It's very, very important, because whatever you plan, you are going to get it ready ahead of time. And if you get it ready ahead of time, you are not going to fall short of what is needed from you. So still under changing eating habits, we will not forget about our monitoring. This our food monitoring. It's what it's going to be throughout our phase one, every day throughout our phase one. You understand? So keep emphasizing. Don't think because you've already explained how to fill the form for the client, you will not be emphasizing. You will keep emphasizing to the client. Make sure you read the time you eat the food, the place you eat the food. Is there any episode of binge eating? Make sure you keep repeating it to the patient so that he will not make any mistake. Or if there are if he has been making mistake, he will correct it. You understand? Then keep telling them about food portioning. That food document I said I'm going to provide you with is a document that contains common food we eat and its calories. So you keep educating the client the importance of knowing the calories of food. Food portioning, you understand? You can even teach your patient how to estimate the portion of food he needs to eat when he or she is not at home. If from what he has learned, he need to be taking, anytime he's taking lunch, it should be a cup. If it is a rice, it should be a cup of rice. If it is pasta, a cup of pasta. If it is swallow, cup of swallow. So you can further teach your patient or client that you can use your tablespoon to measure how many tablespoons can I get from a cup of cooked rice. So if he should go for visitation in a place whereby he cannot carry his measuring cup along with him or food weighing scale along with him, he can use that spoon. Maybe if I should take 7 tablespoons of rice, is equivalent to 1 cup of rice, and that is what I need. You understand? If I should take, let me say, 7 bites of swallow, it's equivalent to a cup of swallow, and that is what I need. You understand? So you keep educating the patient. Tell the patient anything you know it will benefit him or her. Sometimes what you will teach a patient depends on his concern, depend on his patience, depend on what he wants to address. You understand? Sometimes he will what he will ask you will direct you on what he needs to know or what he needs to understand. Then it's very important to know that you should be strict on your meal plan. Yes. Any obstacle, anything that will distract you or that will make you not to comply, you should try as much as you can to avoid it. You understand? That is the importance of that column of asterisk and the place. Where did you eat food? If a place make you to overeat, avoid that place. If a particular friend make you to overeat, please, if that after telling the friend that, look, I'm on a weight loss journey, that friend is not ready to help you, please avoid that friend. You understand? Or tell the friend that, please, whenever we are together, please and please do not eat. You understand? All this will help you to what? Change your eating pattern or habit from unhealthy ones to healthy ones that will help to support your weight loss. And again, eating healthy will help and hunger. Sometimes hunger and cravings is just is a way our body is telling us that it needs a particular nutrient that we cannot understand. When you eat healthy, when you eat balanced meal containing vegetables, proteins, carbohydrates, I'm telling you, your cravings will reduce. Sometimes it will even, you will overcome your cravings. But it takes time. It's not at once. Don't eat healthy for 1 week and you'll be still battling with cravings and hunger. You'll be thinking it's not going to work for you. It will work for you, but it may take time. Behavioral change takes time, and it varies from one individual to another. For some, it takes short time, while for some, it takes longer time. Let's move to the next slide. Let's move to the next slide. Let's move to the next slide. Sorry for the interruption. Next slide. Okay, the previous slide before this. Excellent. I think we are done with module 2 of phase 1 of cognitive behavioral therapy. So we are going to module 3. Don't you people think we should have a break, then we'll come back and continue, or we should continue till 1? We are going to module 3.
Yes, a break, my. Okay.
Okay, do you people think we should go for break?
Yes, I think so. The break might be okay, ma'am.
Okay, so let's decide on when to continue.
Okay, ma.
Two o'clock, ma.
Okay, so no problem. So we are at module 2. We are done with module 2. So we are going to start from module 3 of phase 1 of cognitive behavioral therapy when we are back. Okay.
Am I free to ask a question? Good afternoon, everyone. Everybody has gone out. Yeah.
I think we can start.
Okay.
Let's share the screen. Let me ask him to share the screen.
No, I think I've started again before my network. Let me share it. Can you see it now?
Yes, it's okay. It's, you can see.
Okay, I just hope my network will not fluctuate. So I
Okay.
think okay. So we just finished module 2. And the aim of that's module 2 of phase 1 of cognitive behavioral therapy for obesity. And the aim of module 2, what we all aim to achieve was changing the eating habits, and we've seen all the ways to use in order to change the eating habit. So now module 3 is developing an active lifestyle. So as we move on, if you are recalling what we've discussed regarding sustainable weight loss, so as we move on, if you are recalling what we've discussed previously regarding weight loss, you notice that all the factors, the component of sustainable weight loss are what? Unveiling. You understand? We are discussing it one after another and gradually, not at once. Because if you say you are going to do everything at once, you are not going to get results. So now module 3 of phase 1 of the CBTOB is what? Developing an active lifestyle. That is the aim. So whatever we are going to discuss under this module, it's going to what? It's going to help us to achieve the active lifestyle we want. You understand? And remember, we said this phase 1 is within 24 weeks. That is 6 months. And it is made up of sessions. Each session is a visit, and it's made up of 16 sessions. That is 16 visits. The first 8 visit is once weekly, and the second 8 visit is once in 2 weeks. And I've been telling you that there is no specific session at each module. The time you spend in each module depends on how you are able to cover everything the client needs to know in that module, and how fast or how well the client is complying or is assimilating what you are teaching him or her. So now module 3 is developing an active lifestyle. So here, according to what it said, that it starts in session 2. There's no specific time of the starting. So the primary goal at this module is to what? Increase the level of physical activity. All what we are going to discuss is what? Directed towards increasing the level of physical activity of that client, the level, how active is that client. So you are going to build on that based on the level of his or her activity. So the secondary goal of this module is what? To practice a fitness program that will suit the client. You understand? That is why the client is involved actively in the managing procedure, in the management. Because whatever you have your aim, and the client knows what you want to achieve. So you're not going to decide what is good for the client. You are going to give the client options. You understand? And based on what he said, you are going to agree on what he will be doing so that he will comply. You understand? So in addition to increasing the level of fitness of that client, you are going to introduce gradual formal exercises to that client. But what? Exploring the advantage and disadvantage of each exercise you are going to recommend for that client. You understand? Before you ask your client, you try, before you introduce any form of physical activity to your client, you have to explain the advantage of that form of exercise or activity and the disadvantage. Tell the client, most especially the disadvantage, you understand, or the will I say the unbearable things, or will I say the discomfort regarding initiation or starting of exercise, including delayed onset muscle soreness, DOMS. When you are not used to a particular activity and you are introduced to that particular activity, you should expect that you are going to feel some muscle pain, which is normal, and it's going to wear off with time. You understand? And you tell the client that you're going to start gradually, because since you are not used to this exercise, there is risk of injury. So we are going to start it gradually. Whatever I ask you to do based on your level, do not increase it. You understand? And you're going to talk to the client on the importance of warming up and cooling down after exercises, so that to what minimize DOMS. Another thing you will talk to the client about is the need for consistency, because you will not just exercise in a day, just once in a week or twice in a week for, let's say, a month, and you expect to see results. No. Tell the client, if you really want to see results, you have to be what? Consistent, especially if your aim is to lose weight. You understand? If your aim is to lose weight, you have to exercise daily. That's cardio exercises. Then for strengthening exercises, 3 days in a week. So you now try and look for ways to motivate the patient to exercise. We know that exercise is not enjoyable, especially when you are starting, because it's associated with body pain, living your sedentary lifestyle, maybe always lying down, always asking someone to do a particular task for you. So it's not enjoyable. So it's something you have to look for ways to motivate the patient. You understand? Look for ways. Is it finding exercise partner for that client? Is it giving the client, will I say, a present or a gift whenever he or she do it consistently? Look for ways of motivating your client depending on the preference of your client, the type of client you have. Then before you tell the client to start this particular exercise, you have to educate the client. Yes, the benefit of regular physical activity. It's what you tell the client. It help you in reducing your weight. It's improve your mental state. It's improve the flexibility of your joint. It's reduce the risks of developing metabolic disorders, a lot more. We are all in the field of physiotherapy. I know you have a lot of benefit to educate your patient on. Sometimes when you tell your client the benefit of something, maybe that is the pain point of that client. You understand? In addition to losing weight, the client can tell you that, I don't know, I'm always worried, I'm always disturbed, I can't concentrate, all these things. When you tell the client that physical activity will help to improve your your mental clarity, your productivity, it's one of his pain points. So that will make that particular client to what? To be serious and to adhere to the physical activity you are asking him or her to do. Another thing is, if you tell your client that when you exercise, you're going to it's going to help you to lose weight faster, and when you lose weight, you are going to reverse, if you have any metabolic disorder, you're going to reverse it with time. And if you don't have, you are going to, the risks of you developing it will greatly reduce. And maybe that pain point of that client is that my mom is diabetic, my father is diabetic, and I know how we suffer. I know how we move from one hospital to another in order to manage my parent. So when that client knows about it, he or she will be motivated to exercise in order to get rid of his fears. You understand? And for example, if maybe that particular client is having sleep apnea, difficulty while sleeping, you understand, cessation of, will I say, breath during sleep, or chronic knee pain or back pain or so. So if you tell the client that if you reduce your weight, even 5% of reduction in your weight will improve your condition, this will motivate the client to do the same. And another way you can motivate your client to be physically active is when sometimes it's very important to keep reviews of client that you've previously coached regarding this weight loss. If that particular client should see someone before the onset of the program, and the benefit he or she achieved after the program, that client will be motivated. So that's why it's even very important to have a support group where you add up all your clients that you've treated, or those that are even at the phase of the treatment, in order to serve as a form of motivation for others. So still under increasing physical activity, developing an active lifestyle, there is need to, before you prescribe any form of exercise to your client, there is need to assess the individual physical activity level. You understand? And his or her barriers to weight loss. Assessing the level, that is why I said at the preparatory phase, since after the preparatory phase, your client will go and come back the following week for another section. That is the onset of the phase 1 of the program. So during that time, that 1 week that he will stay at home before coming for the next visit, you should track his food intake, physical activity level, and everything. Because when you know the physical activity level, you are going to progress the client, or you are going to prescribe what the client will do without, will I say, overburdening the client. You understand? Because if, for example, you've assessed, you use that steps in order to assess the level of activity of that client, maybe his daily average steps, it's 2,000 steps per day. You cannot just come and tell the client that you have to be achieving 10,000 steps daily. It's not possible, because even if that client is willing to, and he try to cover 10,000 steps a day, from 2,000 to 10,000 steps, I'm telling you, that client may run away. He may not comply, because he's going to come up with serious body pain. You understand? And that body pain may discourage that client from continuing with the program. So from 2,000 steps, it's okay. You just add 1,000 steps. Okay, you see your average step is 2,000 steps. So we are going to increase the step by 1,000. You understand? So from tomorrow, I want you to be covering getting 3,000 steps daily. And if the client should say, is it possible? Yes, it's not hard. Do you know that for you to get 1,000 steps, you just need only 10 minutes walk? Averagely, rough estimate. When you walk for 10 minutes, you're going to get 1,000 or close to 1,000 steps. 10 minutes. So if you should tell the client the time, the rough estimate of the time, just 10 minutes, I think I can add it to my routine. And sometimes some clients will tell you, I cannot do 30 minutes at a go to reach that 3,000 steps. There is no problem. Tell the client to divide it into two. 15 minutes maybe in the morning, and 15 minutes in the evening or at night, depending on what suits the client. Don't fix time for him when to do the exercise, though you can advise him on the benefit of doing exercise early morning or late in the evening. So then another thing is, you should try to find out, is there any barrier to exercise specific to that your particular client. Maybe the client may tell, oh, I'm having a serious knee pain. I can't walk for long. I think the highest I can achieve a day maybe is 1,500 steps from what you've seen. So I think the first thing you ask the client is, are you seeing physiotherapists for managing this your condition? If yes, know the exercises he's usually know his visit, how many times did he visit a physiotherapist in a week, and the form of exercise that is usually given to him in the hospital. You understand? Then from then, if adding the step can become problematic for your client, leave him or her to continue with the steps he is comfortable with. Maybe you add other form of exercises that is not involving weight bearing. You understand? Maybe like we have a lot of chair exercises that you can prescribe for your clients. It will help to increase the activity level of that particular client. Maybe another client might tell you that I don't have access to gym, or maybe the client will tell you there is security compromise in my area, so I cannot go out and walk for a long distance. It's okay. You tell the client you can do it at home. You understand? You must not go out to achieve your steps. You can do it at home. Get a landmark that you use at home, maybe from point A to point B in your home, maybe in your sitting room. It's a 1 minute walk. That is approximately 100 steps. For example, I'm just citing an example, depending on the how your space is. Understand? If there's a landmark at home that when you go from the beginning to the ending of that place, it's 1 minute, then it's okay. You tell the client you can move to and fro. When you move to 1 minute, when you go back 2 minutes. So when you do it 15 times, that means you've gotten your 30 minutes. You understand? Try as much as you can to find out what is unique to that your particular client. That will help him in adhering to what you advise him or her to do. You understand? Don't generalize everything. The aim is what? To increase the activity level of your client. Everyone is unique. Some clients don't even have time. So you find a way for that client to increase their activity level. Maybe you tell them, okay, do you drive to your office while going to work, or you use public transport? If he or she drives, you can tell the client to park your car a little bit far away from where you go to where your office is. You understand? So maybe 5 minutes away or 10 minutes away. So it will make that client to walk to the office. You understand? And therefore it will increase the client's steps, increasing the physical activity level of that client. You understand? Then another way you can increase you can help the client to increase his or her activity level is you encourage the client to do more of domestic work at home. You understand? Or instead of the client to just sit and send their help or children to, okay, get me my food, get me my phone, please get me my bag, can you get me a glass of water? Instead of it to be sending people on errands within your home, do it yourself. It will increase your what? Activity level. It will increase your step, thereby increasing your what? Activity level. Another very important aspect of this is involving the patient actively in the decision to change. Yes. If you advise your client on what to do, you understand the particular form of exercise that will help that patient to increase his or her activity level. The client may tell you, I don't like this form of exercise. Please do not judge the client. Ask the client, listen to him, hear from him. Okay, which form of exercise do you enjoy? What do you want? What do you want us to do? How do you want us to do it? You understand? From what he said, then you will now see to it. Is it really going to work for you? If yes, even if the progress is little, go with what the client wants. And if not, try convincing the client by explaining the benefit of what you want him or her to do. So now, what are type of exercise recommendation in order to increase the activity level of that your particular client? The first is adopt an active lifestyle. How? Reducing sedentary activities at home. I've already explained that, you understand. Reducing the use of labor-saving devices. For example, wash your clothes instead of using washing machine. You understand? If you want to grind your pepper for pepper mix for we ladies that cook, or even the males that cook among us, please, you can try using pounder to grind. You understand? Instead of you to use grater or blender. There are all ways of what increasing the level of activity. Then if you have in your working place, or if you are going to anywhere there is lifter, please use step instead of what lifter. It will what increase your level of activity. Then instead of your house help or your children to clean up the home, try doing it yourself. Whatever you do, provided it involve moving any part of your body, you are increasing your level of what physical activity. Then if you are you don't have time because of the nature of your work, so even at your working place you can increase the level of your activity. You can take stairs if there are stairs instead of elevator, taking a walk during morning and mid-afternoon breaks, walking rather than driving your car, parking further away in the parking lot, avoiding shortcuts, and introducing following a longer distance to reach your working place instead of you to take short distance. You understand? So another way to increase this your level of activity is to increase the daily step count. Yes, daily step count. I've mentioned it that 1,000 steps is equivalent to 10 minutes. If you take a walk of 10 minutes, it's roughly 1,000 steps. So you, based on what you've discovered from your findings, based on your findings from the steps you track after the preparatory phase, that is when you build on. You understand? If the step level of that particular client is 3,000 steps, please don't rush the client to 10,000 steps. No, increase gradually. Maybe you try 4,000 steps. After 2-3 days, depending on his feedback or her feedback, maybe anytime after my work, I tend to have serious pain, body pain, serious leg pain. If the pain reduces as he continues with that particular step, then you increase it. You understand? If not, you try to allow the client to take that particular step for some time for the body to adjust or adapt before you increase it. Then also another way to increase the level of activity is exercise. Yes, formal exercises, because in the documents I'm going to give you, some of the questionnaires I'm going to give you, and some of the form I'm going to give you, there are different form of physical activities or exercises, formal exercises that have been written, and their physical activity and metabolic equivalent of the task is well written there. You understand? You find things like cycling, daily yoga, walking, playing table tennis, dancing, playing volleyball, swimming, jogging, playing football. All these, they have fixed metabolic equivalent of the tax, and it's usually in numbers. You understand? And what is the benefit of this, knowing the metabolic equivalent of every form of exercise that you carry out, is for it to help you in estimating your calories. You are going to see a formula whereby you will use the steps you were able to cover to calculate the calories of that particular steps. And also you see a formula whereby you use, maybe let's say you dance for 5 minutes. So how will you know the calories of that dance, the rough estimate, because we are not going to get the accurate readings of that particular dance. So what you are going to do is that you are going to use a particular formula. You now use the time you spend dancing, you understand, to estimate the calories. For example, let's say maybe while dancing, you're able to cover, let's say, 3,000 steps. So how you get the calories of that particular steps is that you put you now multiply your weight, your present weight, by 0.005 times the number of steps. The value you get is what equivalent to the calories you burned while dancing. So you will see it all in the form I'm going to share after the class, inshallah. So after that, still following ways to improve your physical activity level is what? Is increasing the patient adherence to exercise. There are ways you help the patient to adhere to that exercise. But these ways depend on certain factors. There are factors that influence the adherence of that particular client to exercise. First is the stage of change. You know, when you are changing, what we are doing is more of behavioral change. So when there is a change taking place, there are phases that someone pass through. So depending on the stage of the change, that will what? Show adherence or what? Non-adherence to the exercises. So if we have the pre-contemplation stage, usually when the patient has no intention of exercising, even in the next 6 months. Yes, because there are patients, if you are free with your patient and you've gained your patient confidence and trust, your patient, there are certain patients will tell you, I don't want to exercise now. I don't feel like exercising. Please don't force the client, and don't judge that client. You understand? Tell the client it's okay. I'm very, very sure with time you are going to start exercising on your own, because you knowing the benefit of the exercise, I know with time you have the zeal to exercise. So then the next phase of change is contemplation, where there is no exercise, but intention to do so there is intention to do so in the next 6 months. You reach a time whereby the client will be telling you, maybe in 3 months to come or 6 months to come, I'll start exercising, but not now. Ma, please allow me. I don't have strength. You know, you've reduced the quantity of food I take daily, so I don't have that energy or strength to exercise. Maybe later on. Don't force the client. Allow the client continue with the little changes in other areas that you've achieved. Then another phase of this change is we have preparation, where no exercise but intention to do so in the next 30 days. You understand? So you see, you are progressing gradually. You are moving, that client is moving from one phase to another. Then there is a phase of action, you understand, whereby the client exercise but not what frequently, not as it's supposed to be. So don't be in a haste to push the client to where he or she is not ready to go to. You understand? Then there will be phase of what? Maintenance, whereby client exercise the way it's supposed to be in what that's the client has been exercising for the last 6 months. So now, what are the having known this phase of change your client is in, what are the strategies you are going to use in order to make this your client to exercise. I've already explained the strategies. You understand? Before this, I've already explained the strategies. You are going to tell him to do one thing at a time. You understand? Encourage him or her. For example, if the client tells you, I can only achieve 2,000 steps in a day, tell the client, you are trying. No, 2,000 steps is not a joke. You are really trying. But do you know that you can increase the level of, you can increase your steps? If you just walk for 10 minutes, you are going to get additional 1,000 steps. So why can't you just add it? 10 minutes, no, 10 minutes, it's too much. Okay, let's do it. Just add 5 minutes. That's 500 steps. You understand? Then telling the clients to increase activities around home. You understand? Rather than asking someone to be doing for him or her. Then increasing the distance he or she walk to his office. You understand? All these are strategies. So now, whether you like it or not, you are going to come across clients that will not adhere to whatever you tell them. You understand? Anything you explain to them, they will even show you they know better than you. You understand? You will not understand. I know the kind of person I am. Even if I should start, I'm not going to continue. So there is no point starting. Please do not criticize that particular client. Do not discourage the client that do not adhere. Keep motivating them, encourage them, tell them, I know, I agree to what you are saying, but why not just try it? Try it this way. Just try it my way. Let's see if it works. If it's not working, then we'll now go your way. You understand? With time, depending on the phase he or she is in the change, behavioral change, the client is going to what? Adhere. Then congratulate on every success, no matter how little success is. Please congratulate the client. It will go a long way in motivating him or her. Then you have to what? Unconditionally accept the patient behavior. Remember, he has unwanted behaviors that you want to change in order to achieve what you want. So it's not going to be a day job. You understand? Definitely, he or she will annoy you one time or the other. Please try to calm your temper. Please try and be so gentle on the client. You understand? Even if he or she annoys you, try and control your temper. Still advise the patient to do more. Motivate the patient to do more. Tell the patient you can do it. I've seen a lot of people that are not as strong, as motivated as you are, but they were able to do it. If they can do it, you too can do it. You understand? Try all possible ways to motivate the client to do it. Do not force the client to do what you want him to do. Rather, try to motivate him to do it willingly. Then there are other ways that will help you to make the client adhere when you look for way of solving problems, because problems are going to arise whether you like it or not. You understand? During the program. So you should try long-term success. Long-term success that's ways to get long-term results, long-term weight management. You understand? All the skill that you need to make the patient to get result, or to change a particular negative habit and replace it with positive habit. Please try and do that. Yes, try and do that. Try and encourage the client. Try and teach the patient what to do. And another thing I will keep emphasizing that makes a patient to adhere is when what you are doing is in accordance to what he wants. You understand? His preference. So that will make that your client to adhere. For example, in addition to step, you can get a client that like dancing. He or she likes dancing. or she hates exercising, any form of bricks walking. If you ask the client to do, the client will not. But that particular client love dancing. Please encourage the client to dance to his or her favorite music. You understand? Start with like 5 minutes, then you increase the timing to like 10 minutes. So this is all we have in module 2. So now we are going to what? Module 4 of what? Phase 1 of cognitive behavioral therapy. That is addressing obstacle to weight loss. Like any other journey, weight loss is also a journey. So definitely you're going to what? Come across obstacle. So if you should come across obstacle, if your client should come across obstacle, do you allow the client to just stop the weight loss or to stop the journey? No, 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 no. So you try as much as you can to identify obstacle to weight loss unique to that your particular client. We have questionnaire that I'm going to share. This questionnaire is termed the weight loss obstacle questionnaire. It is usually you're going to give your client to fill it weekly alongside the what? Food and physical activity monitoring form. You understand? Remember, it is at this module we now initiate what? Identification of obstacle to weight loss. Yes, it is at module 4 that we aim to address it. We've started the program since with preparatory phase, then module 1, module 2, module 3. So now is what? Addressing obstacle to weight loss. In module 1, we monitored what? Food, physical activity, and weighing. In module 2, it was what? Changing eating habit or behavior. In module 3, it was what? Increasing level of what? Physical activity. So now module 4 is what? Addressing obstacle to weight loss. This will help you to achieve what? Cognitive behavioral skill. Because most of the obstacle to weight loss sometimes are what? Behavioral. You understand? Some negative thoughts. You understand? Lack of motivation from people that stay around you. So addressing this obstacle will help us in achieving our what? Cognitive behavioral skill. So you are going to see the questionnaire, and there are questions. There are questions you answers. So based on your score, that will what? Direct us on the obstacle to what? To address. You understand? For example, some of the questions you find in the weight loss obstacle questionnaire is, the first one is, did you fill in your monitoring records every day? You understand? Did you fill in your monitoring record every day? That's your form for monitoring your food intake and everything. Do you do it every day? So the options, yes or no. So if you tick yes, it's okay. When you say no, another question is you need to answer another question. How many days did you miss? If you state the days, what was the reason? Why didn't you record your food, the food and drink you consume on Monday? Why? So you're going to state the reason. I left my phone at home. I forgot my phone at home. I didn't eat at home. All these are obstacles. So if the reason is that you left your phone at home, although you prepare your food while leaving home, you have your healthy portion balanced meal with you, but you left your phone at home. So hello? Okay, someone is distracting us. So if you left your form at home, then it is very important for you to always put extra forms at your working place or inside your bag, so that even if you forget to take another form, if you should go to the office, you are going to see your form. You understand? Or if you should open your bag, you are going to get a form that you use. So it's very, very important to identify the obstacle. For example, another obstacle that may arise along this journey is I didn't do my work. Yes, I didn't do any step. My step was below 1,000. The reason you have to have a reason for that. Maybe the reason is that it was rainy. It was raining, that was why. I was waiting for the rain to stop so that I can go out for my work. You can tell the client, rain it should not be an obstacle since you cannot stop rain and you cannot decide when it will rain. So what you will do is whenever it's raining, you can get your step at home. You can get your step at home. So you see, knowing the obstacle will enable you to what? To address it. So another thing is still in module 4 is not only addressing the obstacle to weight loss. Remember, we've learned series of things. We've talked about filling our form, then exercise, weight loss obstacle questionnaire. That's creating a collaborative approach to adherence to physical activity in order for us to have patient adherence. So you are still going to carry it along with you in what? Module 4. So you are going to revise the monitoring records. Check, is the client recording correctly? Is he missing something? Is she omitting something? Then you check, okay, is he overestimating the calories or underestimating the calories of food he or she is consuming? If it is so, re-educate him or her on the calories, the importance of trying to get near normal near to correct estimation of the food he or she is eating. Tell him the implication of overestimation. If you are overestimating, we are not going to see results. You understand? Tell him the importance of documenting, because whatever you write, you are not going to forget. So another thing you get to address in this stage is what? Antecedent stimuli. And what this implies is a particular behavior that triggers an action. You understand? A particular event or situation that triggers you to do something that is not right. You understand? To do something that is not helping your weight loss journey. For example, let's say we have environmental antecedent stimuli. Let's say if you should perceive the smell of meat pie or the smell of baking, I must buy that meat pie. You understand? There is a particular route you follow whenever you are going to your working place or whenever you are going back home. And there is a bakery, they normally bake meat pie. And if you should perceive the smell of that meat pie, you cannot resist it. You must get that meat pie. So I think the best thing you will do is to what? To change the route you follow. You understand? Try and bypass the bakery so that you will not be what? Perceiving the smell until you have control over food. Because at the beginning of the program, or mostly at the phase 2 of the program, is a phase whereby you try to gain control over food, not food controlling you. Another thing is addressing eating stimuli. For example, there are situations whereby if you visit your friend home, no matter what, you must what? Eat junk food. Because maybe that's what she does for a living. You understand? Try as much as you can not to go while she's making it. You understand? Or even avoid visiting her at home. If you really want to meet her, you can decide to get a meeting point. Let her come and visit you, or maybe you can go for an outing if you really want to meet, so that you will not what? Go to her house in order to avoid eating the junk food, since it will what? Not support your weight loss program. Then another thing is you should try as much as you can to be proactive in problem solving. Since we've agreed that obstacle is what is certain, you must come across obstacle along your journey. So what do you supposed to do? You're supposed to learn ways of problem solving proactively. You understand? If there are events that triggers a particular action that is not wanted, you have to address that event influencing the eating or influencing that particular behavior that is unwanted. So how do you solve the problem proactively? The first step is what? Identifying the problem. Yes, that is the importance of the what? Weight loss obstacle questionnaire. That is why if a question is asked, did you record your food as you eat it at the right time? If it is yes, you don't have any problem. If it is no, the next question you answer is why. No, how many times? If it is frequent, then that means it's your behavior. Then the next question you will answer is why? Why do you do that? You understand? So from answering that your why, you've identified the problem. Then the next is understanding the problem. Yes, you have to understand. You have to let your client know that this particular behavior is a problem. It is a problem because if you will not record your the food and drink you consume at the time of consumption, you may forget. You might not record the exact portion you've taken. You understand? Or you may even forget to record maybe an episode of snacking on few pieces of nuts because it will skip your memory. You understand? So letting that particular client to know that particular thing is a problem, understanding it will make the client to what resist from doing it again. The next step is what? Consider as many solutions as possible. Yes, many solutions as possible. For example, let's say you find it difficult to achieve your target steps. You understand? So what are the ways you follow in order to achieve your target step? Many ways. Okay, from now onwards, I will be the one cleaning my house. I'll be the one cleaning my house, or I'll be the one cleaning my room. You understand? It's going to increase your steps level. Okay, I don't have time because I enroll on an online class that usually takes the time I use in exercising. Let's say maybe the online class is 2 hours. So that, and it's usually in the evening, and that is the time I do go for my walk. So what will you do? You will just skip the exercise because you don't have time. No, you can decide to walk, to move around as you listen to the what? To course, as you listen to the program online. You understand? You can decide to move around to and fro. Maybe by the end of 1 hour or 30 minutes, you end up getting additional 4,000 to 5,000 steps. So try as much as you can. Bring options, bring solutions to problems. Ask the client to bring his own solution also. So you have many options. In case this particular problem arises, you have many ways of solving it. Then the next step is what? Think of the advantage and disadvantage of each solution. Weigh the pros and the cons. You understand? If the advantage outweighs the disadvantage, then you carry on with it. If the disadvantage outweighs the advantage, then you look for another options from the many options you have you have created. You understand? Then step 5 is choose the best solution or combination of solutions. Yes, you must try and be flexible. Be flexible. Allow your client to be flexible. Do not be fixed on a particular solution. You must not tell the client to stick. You must walk around 8 a.m. Yes, you must do your exercise in the morning. If you don't do it in the morning, I don't think I'm going to acknowledge that. You understand? No, allow the client to choose the right time. And sometimes, even if you have fixed time to do something, and a situation that you are not aware can arise, which will stop you from doing it at that right Another thing is what act on the solution. If you've decided on a solution to a particular problem that is frequent or particular unwanted behavior that is frequent, please act on it. Don't just know it. Yes. Tell the client to please act on what we discuss. Don't come next week repeating the same problem. Please and please, I'm begging you. Because if you should come the same week, another week, repeating the same problem, we are not going to progress. You understand? We are not going to progress. So I want us to be progressing. Then review the process of the problem solving with the client. Try to review. Whenever you have a session with your client, teaching him or her a particular concept, before the client leave, please revise it with the client or tell the client to come again so that you will know if he or she understood everything or even understood it correctly. So another ways to help in addressing non-eating stimulus is addressing it problematic thoughts. Yes, I said it earlier on. That was why we talk about mindset. Usually, people with this weight issue usually do tend to have negative thoughts, negative thinking, negative talk. You understand? Negative self-talk. So try as much as you can to what identify a problematic thought in time and what address it. You understand? For example, when a client usually use food as a reward, tell the client that it's not healthy to reward yourself with food. You know, sometimes when you are happy, you decide to, okay, let me go out and eat. Let me buy the you understand, for rewarding yourself. Teach the client other ways. He or she can what? Buy himself book. Maybe you have a book that you've been wanting to buy and you did not buy. So if anything happened that you need to celebrate or you are very happy about maybe passing a promotional exams, getting a contract that you've been looking for, instead of you to buy food as a reward, please buy yourself a book, buy yourself a clothes. You understand? Take yourself to a spa. So all these, think of as many as possible options for that can serve as non-food reward that you'll be able to reward yourself. Doing this will help greatly in what in overcoming eating as a reward or food as a what trigger. You understand? So another thing you are going to address at this module 4 is what? Is you have to educate your client about relapse. Yes, relapse. There is difference between a lapse and relapse. A lapse is what? An episode of a client going off track. One episode of a client going off track. For example, skipping 1 day of exercise, skipping 2 days of exercise. This is what? A lapse. So it is different from relapse because relapse is what? Series of relapse will combine to form relapse. If you skip exercise for like 4 days in a week or skip exercise for 5 days in a week, it's series of what? Elapse. And if you are not careful, if you are not careful or you are not intentional, you are going to what? You are going to go off track. So you stop exercising, and if you stop exercising, your weight loss will stop, or you will even regain weight. You understand? So explain this to the client clearly, that it's okay. It's it's a normal part of the journey to experience a lapse. Maybe one day you skip exercise for a day. Maybe you overeat, you overeat twice in a week. You understand? Maybe you ate junk once in a week. All this might not be a problem if it is only once or twice at most. You understand? But if you allow it to continue, it will now what? It will now go to what? Relapse, whereby you will be discouraged and stop the weight loss at all. Let me give you an example. For example, maybe you traveled, you are not at home, you traveled, and where you went to, you don't have control over food. You just have to eat what is given to you. You understand? So when you spend only 3 days, when you came back, you now weigh yourself and you've added 2 kgs. So what you're supposed to do is you should not be discouraged, because some people will have negative self-talk. They will be saying, just because I went off track for 3 days and I'm adding 2 kg, I don't think I can continue this weight loss journey. So I will not enjoy myself just because I ate for 2-3 days, and that is all. So some clients will just be discouraged, and they will just go back to their unhealthy, bad habits of eating, and they will even stop exercising. Before you know it, the weight will keep increasing, and if care is not taken, they may even regain the lost weight and even add above their starting weight. So try as much as you can to educate your client on relapse and its effects. You understand? So another thing that will help you to address this weight loss obstacle is what? Is involving people around you. Yes, if you want to lose weight, please tell your spouse, tell your partner, look, I want to lose weight because of my health. So I want you to what? To assist me. There are many ways people around you can assist you. First is reminding you to do your activities, your physical activity. You understand? They can also assist you or support you by stopping you from overeating or junk eating. You understand? But if you did not involve them, if you did not explain to them what you are going through or what they need to do for you, they can help in sabotaging your weight loss effort. Maybe if they are your partners in junk eating or unhealthy eating, they'll keep bringing the unhealthy food to you. You understand? And sometimes even if you say if you tell them, it's time for me to work out or go for a walk, they will tell you, just wait, let's just now, let's finish watching this episode. But if they are actively involved in the program, they are going to help you and they are going to assist you, and this will help in overcoming some of the weight loss obstacle. So this is the end of module 4 of phase 1 of cognitive behavioral therapy. So now let's go to module 5. Module 5 is addressing weight loss dissatisfaction. Yes, as you move on, you understand, just from what is written there, between 16 weeks and 20 weeks, or even to the end of phase 1. From 16 weeks, you've when you reach when you've reached 16 weeks, I think you've even entered the second 8 sessions of phase 1 of the program. So you are moving towards the end of phase 1, since phase 1 lasts for 24 weeks. So at this phase, there is need to address weight loss dissatisfaction. There is a questionnaire that you use in getting the information you need in order to act The questionnaire is termed the what? The body image inventory. There are a series of questions that are asked and you're going to fill it. You understand? When some of the questions include, have you been dissatisfied with your body? You understand? Because there are scenarios that usually arises. For example, sometimes when you lose weight, people tend to come up with saggy skins. You understand? So sometimes the client will be disturbed. I've lost the weight I want to lose, but I'm not happy with the way my body is looking. You understand? So you have to what? You have to address that thinking or that thought. If not, it will what? It will sabotage your effort because the client may what? Stop the program. The clients might go back to their unhealthy habits. You understand? So try to explain to the client explain more on the benefit of losing the weight. You understand? And tell the client on how he or she can improve their appearance. The easiest way of improving your appearance is you changing your clothes. Because if you lose sometimes 10 kg from your weight and you are using your old clothes, you'll not be looking good in the old clothes because the clothes will be oversized. You understand? And people will comment. People will tell you things that will discourage you. Some will tell you, Kai, you're not looking beautiful. When you have weight, before this weight loss, you are looking more beautiful. Kai, you are not looking handsome. You are not looking good. You understand? It depends on how you present yourself. So try as much as you can from the questions you ask the client. You have to, from the question, you get to know whether that client is not satisfied with their body, you understand, after the weight loss. So if that client is not satisfied with his or her body after weight loss, try what? Re-educating him. Try changing his or her mindset. Tell her ways or tell him ways that he or she can improve their what? Appearance. Another ways of another weight loss dissatisfaction might be that a client might tell you that I'm not happy with the kgs I've lost. It's too small. The weight loss procedure is very slow. Imagine 16 weeks, I'm losing only 10 kg. And before the onset of the program, you promised that I'm going to be losing 1 kg per week. And now, 16 weeks, I'm at 10 kg down. I'm not happy. Try and go through the monitoring forms. If there are any episodes of unwanted eating or skipping of exercises or skipping sessions, you understand? Or if that particular client maybe is taking some drugs, there are certain drugs that may slow down the weight loss. Or if that particular client, let's say, for example, for ladies, if you are in your menopause, that phase can also slow down your weight loss. Or if that particular client don't balance his or her meals, maybe I don't like vegetables, so that client don't take much vegetable or don't prioritize protein in the diet or restrict him or himself to only a particular class of food. So try and check. Definitely you are going to get one or two things that lead to that result. So if there is any findings, try and explain to the client and encourage the client, motivate the client that it's better than adding weight. This 10 kg of your weight will reverse a lot of problems you are facing. You can even ask if from your clerking, from your preparatory phase, if he or she is suffering or having any knee pain, sleep apnea, difficulty walking, difficulty in falling asleep, difficulty while climbing stairs. All these things are things that will help you to address some problems later in the program. So addressing weight loss dissatisfaction will help with what? Adherence to the diet. It will also help with adherence to the what? Weight loss program. Because if you did not address the weight loss dissatisfaction, the client might not complete the program. So this is very, very important. I will share the questionnaire of the body image inventory. So you go through and see everything you need to ask the client. So other procedures of addressing this weight loss dissatisfaction is detecting weight loss dissatisfaction. That's from the weight loss obstacle questionnaire. There are obstacles that may be led to not the client getting his or her result. So from those obstacles, you try to educate the patient, enlighten the client, and motivate the client to carry on with the program. Another thing is you should it's very important to identify the reason for the weight loss dissatisfaction. All is in the body image inventory questionnaire. You understand? From the questions you ask, you are going to identify a lot of reasons why the client is not satisfied with the weight loss. Sometimes another reason might be unrealistic weight goal. You understand? Unrealistic weight goals. Client aiming to lose more than expected. So sometimes even if you address that by enlightening them or educating them from the onset of the program, they will still carry along that goal of losing very, very fast. Sometimes they may even go they may not even follow your instructions. They will be over restricting their diet so that they will lose weight faster than is expected. So if unrealistic weight loss goal is one of the reason for this weight loss dissatisfaction, you try as much as you can to address it. Another thing is the negative body image. You understand? All this, how to get to address this is through the body image inventory questionnaire. So another thing that is very important at this phase is addressing barriers to accept a reasonable and healthy weight. You understand? Yes, it's very, very important for you to motivate the client or to make the client to accept the reasonable healthy weight loss. Yes, 0.5 to 1 kg per week. You understand? So here we can use two strategies. If dissatisfaction occurs in the first 12 weeks of the treatment and is associated with lower rate of weight loss than the weekly CBT/OB week, it is addressed via the strategies we followed in proactive problem solving. You understand? You are going to follow that procedure. Okay, what led to this dissatisfaction? What make you not to lose the weight as expected from the program? From the answer to these questions, you are going to know where the problem is from. And if you should get to know the problem, then you follow the steps in problem solving to solve the problem. You understand? And if the weight loss dissatisfaction occurs after 12 weeks, it is addressed directly. You identify the reason for the weight loss dissatisfaction. Maybe it may be unrealistic weight loss goal, dysfunctional primary goal for losing weight, or negative body image or negative thought. So we are going to address it based on the reason. So other procedures or strategies in order to overcome this weight loss dissatisfaction includes which reason for weight loss dissatisfaction do you want to address at first from your findings, from the questionnaire you gave the patient to to feel. You understand? If patients do not report a negative body image, address unrealistic weight loss goal, and eventually dysfunctional primary goals for losing the weight. Do you get me? From the inventory, there are questions that will direct you towards knowing he has negative body image. I'm not satisfied with the way my body is looking. You understand? If it's not directed towards that, maybe if you keep asking the client, you find out that his main problem or issue is that I want to lose more than this. This 10 kg in 16 weeks or 12 weeks is not enough. It's not what I expected. You understand? So you address it. In essence, what I'm trying to let you understand is that this weight loss dissatisfaction is best addressed depending on your findings. You understand? Everybody is unique. What client A is not satisfied with may not be the same thing client B it's not satisfied with. Maybe client A will be concerned about the look, how I'm looking. I'm not looking good. I'm not looking okay. Client B may be complaining of the numbers I lost is too small for this program. All these troubles, all this weighing, all this measurement of food, all this exercise. Still, I only lost 10 kg in 12 weeks. I'm not happy with it. So you are going to address it based on the client findings. So now, the next thing is we are going to what? Model 6. What is this model 6? The model 6 is trying to address obstacle to weight maintenance. I've said earlier on that the whole program lasts for 1 year, 6 months. 6 months, phase 1, where we discuss about all the modules, changing eating habits, first monitoring food, physical activity and weight loss, changing eating habit, introducing physical activity, addressing weight loss obstacle, addressing weight loss dissatisfaction in module 5. So module 6 is addressing obstacle to weight maintenance. The aim of CBTOB is to lose the weight and maintain it. So definitely we are going to come across obstacle to weight loss maintenance. So it's going to start the main strategy, the main procedure is at the phase 2, but you start it at the end of what? Phase 1 of the program. You understand? So that's why the module 6 is just to address obstacle to weight maintenance. How? Interrupting any weight loss attempt. The first attempt to address obstacle to weight loss maintenance is for you to instruct your client to stop any effort to lose weight. If everything work out as it's supposed to be, at the end of phase 1, your client is going to lose nothing less than 20 kg. It is expected. Some can lose above that. Some can lose 24 kgs. Some can lose 30 kgs. You understand? But if it's done rightly, your client is going to lose nothing less than 20 kg. So if you've achieved that 20 kg, even if it is not the target weight of your client, you are going to stop the weight loss so as to see if your client is going to maintain it. You understand? That is why module 6 address obstacle to what? Weight maintenance. And the first step is you interrupt any weight loss attempt. Calorie restrictions and increasing exercises. That's increasing dosage of exercises. You maintain the portion of the food that particular client is eating at that particular time. And you maintain the level of exercise that particular client is maintaining at that level, at that point in time. You understand? Doing this will stop further weight loss. You will end up maintaining the weight at that particular time. So the next thing is developing the skill to maintain long-term weight loss. And through which ways can you develop the skill to maintain this long-term weight loss? Here are the procedures. Educating on weight maintenance. Yes, you have to educate your client on weight maintenance. Because you want to maintain your weight, that does not give you that does not make you to go back to your old habits of eating. And that does not imply that you should stop exercising. If you want to maintain the weight loss, you have to continue exercising, but you're not going to increase the dosage. You understand? Because you want to maintain your weight, you have to keep eating healthy, portioned and balanced meals. You understand? The same portion you are eating at that very point in time, you are going to maintain that. If because you want to maintain your weight, you went back to your old habits of eating, you increase your portion and you stop exercising, your weight is going to come back. You are going to regain back your weight. So you have to make it clear to the client. Because if the client should know that if I should go back to my old ways of eating and sedentary lifestyle, my weight I'm going to regain back my weight, the client will be what? Adherent to the portion of food and the balancing of food and even the exercise. And it should let the client know that maintaining the weight is more difficult than losing it. Sometimes it's very easy to lose the weight, but maintaining it, that is where the work starts. You understand? Another procedure is involving the patient actively in the decision to start weight maintenance. Educating the client about the advantage and disadvantage. You understand? Tell the client you've come a long way in losing this weight, and look at all the benefits you've gotten from the weight loss. Your BP drugs, the dosage has been reduced. You no longer take your diabetic drug. Your knee pain, it's over. You are very active now. You are more productive. So if you go back to your old ways, you are going to regain back your weight and you are going to go back to all what you've get rid of. It's going to come back, maybe even worse than your previous stage. You understand? So if the client should know about this, that client will make up his or her mind to what? To maintain the weight. Another way of addressing weight loss maintenance is you have to be weighing yourself weekly. Yes, you have to be what? Weighing yourself weekly, because if you are not monitoring your weight, sometimes when the weight will start coming back, you may not be aware. You understand? Another reason for weekly weighing is that if you keep losing the weight, then definitely your food will be reviewed, and even your exercise will be reviewed, because the aim is for you to maintain the weight for long time so that it will become part of you. Another ways you another ways of maintaining this weight loss is adopting eating habits conducive to weight maintenance. That is what I've already explained. You understand? The Mediterranean diet. That is, all classes of food should be well represented. More of vegetables, moderate protein, moderate carbohydrates, and what? Little fat. This will help you to what? To maintain your weight. And it will help you to maintain the weight in a healthy way. You understand? Because you are going to nourish your body with all its needs. You are not going to come up with any nutritional deficiency. Another thing is adopting physical activity habit, also conducive to weight maintenance. You understand? this is what we've talked about. You still be doing your exercise. For you to maintain your weight at that present phase, you have to maintain your steps at that level. And the formal exercise, the dosage of the formal exercise you are used to. If at that point in time, your daily step is 8,000 steps, you must maintain that 8,000 steps. You must not reduce the step, you understand, and you must not increase it. If in addition to this, if in addition to 8,000 steps, you usually do high intensity interval training, 10 minutes, 3 days or 4 days in a week, you have to maintain it. Because if you stop doing it, your weight may come back. You may regain some weight, even if it is not as fast as the way you lose the weight. You understand? If your daily step is 10,000 steps, you must maintain that 10,000 steps. Don't say because I've lost weight, let me go back to 5,000 steps. You may regain back your weight. So let the client know. Because if the client know, he or she will adhere to all these rules and regulations you are giving him or her. Another ways of maintaining this weight loss maintenance is constructing a weight maintenance mindset. Yes. Collaboratively create a list of the patient's personal reason for maintaining the weight. Yes. You must find out whether he or she can still recall why he needs to lose the weight, or rather 100 reasons to maintain that weight. You understand? So if so, am I audible now? Can you people hear me? Hello?
Yeah, hear you, ma.
Yes, hear you.
Okay. So, if yes, okay, as I was saying, you have to if after explaining why the client need to lose to maintain the weight to the client, maybe you have 100 reasons why the client need to work hard to maintain the weight. If all these 100 points you explain to the client did not resonate with the client, I'm telling you, the client will not see any reason to lose weight. Sometimes some people plan to lose weight maybe because of an upcoming occasion, maybe wedding ceremony or something similar to this. So if that particular client don't have strong reason to lose and maintain the weight, I'm telling you, after all the education, that client will not be serious. He or she will not adhere to the procedures that to make him or her to maintain the weight he has lost. So what you need to do here is for you to try as much as you can to make the client to get information from the client. Why do you need to maintain this weight? I'm very sure after series of asking or explanation or education, the client will see some reasons that he will hold on to that will make him or motivate him to maintain the weight. So now, what are the things that will help you in order to get or to achieve weight maintenance mindset? First is meal planning. Planning your meal is very, very essential, because if you don't plan your meal, you are going to what? Eat out of portion. And when you eat out of portion or out of budget or out of even the healthy options, you are going to what? You are going to sabotage your weight loss effort. Another thing is conscious eating. There is what we called eating with your five senses. Whenever you want to eat food, you should eat with your five senses. That is, you should, when you are eating, do not use any device, maybe your phone. Do not be pressing your phone while eating, or watching a film while eating, or talking while eating, because if you are distracted, if you are doing another thing apart from that eating, you may finish eating without being satisfied. You understand? You may finish your whole portion, and after that you will now find out that, I'm still hungry, because you are not even intentional while eating. So you eat with your five senses. You look at your food very well. You use your hand to touch the texture, or if you don't want, if you use spoon in eating, you carry your food with your spoon using your hands. When you put your food in your mouth, make sure you chew it very, very well. Appreciate the taste of the food, you understand, before swallowing. Don't just take in your food and swallow without chewing. It will not help you to achieve satisfaction, you understand. And also, make sure you finish the food in your mouth before taking another food in. This is what conscious eating. And another thing in conscious eating is that, please, when you are satisfied, you should what? You should stop eating. And don't even eat when you are not hungry. Eat only when you are hungry. Another thing is cognitive rewards. What we said, when you do something that makes you happy, or maybe you achieve what you want, or you were consistent with your exercise for 1 week, please reward yourself. Reward yourself, you understand. You can you can appreciate yourself. Yes, appreciating yourself. Umi, job well done. You did a very, very good work. Imagine throughout this week you did not skip any day without reaching your step target. Imagine this week you didn't eat out of portion. Umi, congratulations, job well done. You can appreciate yourself. You understand? You can decide to buy yourself a gift. You understand? This will make you to what? This will motivate you. Another thing is proactive problem solving. We've already explained what proactive problem solving is. As I said earlier on, a lapse or going off track is what part of this weight loss journey. There is no way, no matter how determined or how serious a client is, will go from the beginning of the program to the end without going off track. Is not possible. But what we want is, what you try to explain to the client is, if you should go off track once, don't be discouraged. You understand? If you recall that, this, what I'm doing is not in line with what I want to achieve, so there and then try as much as you can to go back on track. You understand? One episode of unhealthy eating cannot sabotage your weight loss effort. You understand? Skipping a day in a week without getting your step or having your exercise done is not going to what? Sabotage your weight loss effort. It is only when you do it consistently that it will now lead to what? Weight regain. You understand? So try as much as you can. From all the questionnaires you give your client, you are going to get all his weight loss obstacle, all obstacle to losing weight, obstacle to adhering to exercise or healthy eating. And from what we've explained, you've already provide him or her, or both of you, you've come to a conclusion on how to solve all the problems that you've identified. So whenever similar problems surface during the maintenance phase, you use the proactive problem solving method to solve that problem. Another thing that will help in maintaining this weight loss is there are forms that you are going to be given that will help you to address your what negative thoughts, negative self-talk. I'm going to provide you with the form also. In the form, there are ways you address negative self-talk, you understand? Or there are things you say to change your negative thinking about food or about a particular physical activity. For example, let's say you're always, whenever you go for shopping, you understand? What you normally do is, I can't go to shopping without buying chocolates, or I can't go to shopping without buying cake, or I can't go to shopping without buying pizza. So what you will do in order to overcome that your negative thinking or negative mindset is, I will go to shopping and I will only buy healthy foods. You understand? I'll go to shopping and I'll only buy healthy foods. Another thing is, that you can change is a negative self-talk that you can change is, for example, you can decide, I'm tired. I don't feel like walking. I don't feel like going to the gym. I don't feel like exercising. What you will do to address that is tell yourself, I am capable. I can do it. I need to go for work. I'm going to work. I'm going to get my targets set today. You understand? So there is also a form that gives you example of negative self-talk and the way to change it to positive way of self-talk. You understand? But I'm not trying to say that is the only thing, that is the only talk that is usually happen to client. Every client is unique. You understand? From all your assessment and all the implementation of the program, the education and everything, before the end of the program, you will become familiar with all the patient's attitude, his obstacle to weight loss, his negative self-talk, his fears, his concerns. You're going to be used to all what I've mentioned. And since you're familiar with the patient, you are going to address his problem, his problem based on what he presented with. You understand? Another thing that help you to maintain this weight loss is what? Identify and address high risk situation. Yes, we have high risk situation. This one is also what's unique to what every client. Not everyone is the same. What you can term as high risk situation may be different from what someone can term as high risk situation. So try as much as you can to know what is unique to that particular client you are treating. You understand? If his high risk situation is holidays, whenever there is holiday whenever there is holiday, you have no option than to be eating junks, to eat out of portion, because you are going to eat in groups. You are not going to eat alone. You are going to eat with your kids. You're going to eat with your sisters. You understand? So if holiday is high risk situation to that particular client, you people should find a way of what? Solving that particular problem. Why some illness? If I'm sick, I will not work out. I cannot work out, and I don't enjoy healthy foods. So try as much as you can to overcome that or address that issue if it is unique to your what? Client. Another things that can be a risk of that's regaining the weight is behaviors. Certain behaviors can be termed as high risk situation. Like like eating food rich in fats and calories. Some people so much like fries, you understand? Some people will be telling you fries are my weak point. I can't do without fries. So if that particular food is a risk of going back to unhealthy eating method, you try to educate the client on how to change it to a healthier version. Maybe if you like a crispy nature of fries, try grilling. Teach the client how to grill, because sometimes when you grill food, it tends to be crispy as if it is deep fried in oil. Another thing that can serve as high risk situation is what thought dysfunctional reactions to weight gain or false confidence, or weight regain or false confidence. There is one, let me give you example here. There is a particular client that set to lose her weight. You understand? Though it's not through this method, it's through surgery. So when she now saw, she now saw one public figure, she lost so much weight that you cannot even recognize her. So do you know that this particular client started having a panic attack? She called me, she was scared, she was crying, she can't hold her breath. I was asking her, what's the problem? That she don't want to be too slim. She don't want to be too slim like so person. You understand? So if that is the case, that she's not going to follow the meal plan we gave her. So I now counsel her. I educate her on way that you can maintain your weight after you hit your target. You understand? So there are certain things that may prompt someone to what gain back the weight. Some might be their target things. You understand? They are not looking beautiful. They are not looking attractive. I don't want my if it's ladies, I don't want a man to find me not attractive. So some of them will decide to start, let me go back to my own ways of thinking. So try and identify such thoughts. If there are things like this, please try to address it so that you can get results. Another way of maintaining this weight loss is preventing a lapse becoming a relapse. Yes, I've already explained it previously. I explained to you the difference between lapse and relapse. Lapse is just an episode of someone getting off.
I think you are not audible.
Okay, hello, am I audible now?
Yes, ma,
What
you're
about
audible
now?
now. Yes, now
Okay,
we can hear you.
okay. So I'm talking about preventing a lapse becoming a relapse as another way of maintaining the weight loss. I've already explained what a lapse is and what a relapse is. Lapse is just an episode of getting off track. You understand? Skipping a day of exercise, binge eating once in a week. All these are lapse, and it's a normal part of the weight loss journey. You understand? But you have to prevent.
Ma, the
You
slide are
have
not
to
showing
prevent.
now.
Okay. Can you see it now?
No, you are push it at the to the right edge of your screen. So maybe if it will come to the middle, we might be seeing it clearly.
Okay. Okay. Can you see it now?
No, we can't see it up to now. I think the arrow at the bottom that you are seeing by the left, the margin line, is the one that you query. Yeah.
Mm. So can you see it now?
We still can't see it, ma. But I don't
So
know of others,
maybe
but I specifically I can see it.
maybe if you, I think this particular the font size at this slide is very tiny. Maybe that is why. You see the
Okay.
next slide. I'm sorry for
Okay.
that. So
Okay.
so so you educate the client on not allowing a lapse to become a relapse. You understand that if you should get a lapse, it's normal. It's normal in any weight loss journey. So when you just get a lapse, try and go back to track. Yes, don't allow it to persist, because if it persists, it will turn to relapse, and relapse will lead to what? Weight regain. Another way you can maintain this weight is what? Addressing weight regain. So how do you address weight regain? First is identifying weight variation. That is why it is very important to weigh yourself weekly. even as you have come to the phase of maintenance, you must weigh yourself weekly. Because if you are careless, you are not weighing yourself weekly, it will reach a stage whereby you will not even notice till you've added like 4 or 5 kg. And if you're not careful, that will discourage you. You understand? So weekly weighing will what? Will tell you the pattern of your weight. You understand? If it is the way it is not reducing, it is not increasing.
Ma, you are not audible, please. We can't hear you.
That is what you want. You keep the exercise, the daily exercise, and reason. Then you have to go back of the food and also review the exercise routine of that particular client. So if you should do a weekly weighing, you will quickly identify a problem and you solve it at the right time. Another ways of preventing or addressing weight regain is you identify reason for the weight regain. Yes, that is why I said if the weight is increasing, what you will do is what? Is to go back and review the food. That is the another importance of the daily food monitoring chart. You understand? And the physical activity monitoring chart. Whenever there is a problem, the weight is increasing. Okay, we've started weight maintenance. The first week, the weight is okay. It's stagnant. It's the way it's supposed to be. The following week, 0.5 kg increase. Then there is a problem. How will I identify the problem? Go back and review your food and what? The exercise routine. From there, you identify the cause and you now what? Solve the problem. So the next way to maintain this weight is to use the PPS in the event of 3 possible scenarios. You understand? For example, what we mean here is if you've identified a particular problem as the reason for your what? Weight regain. You understand? It's not, you cannot ascertain that this is the particular reason why I increase my portion. For example, if it did not repeat itself 3 times, are you getting me? For example, when I reviewed the food chart and I found out that your portion of lunch is increasing. Every day you are increasing the portion of your lunch, but your breakfast and dinner, it's okay. It's the same portion I asked you to be eating, but your lunch is increasing. You understand? What is the possible reason? If, for example, for 4 days, what happened is that you are eating in group. You are not the only one eating. I can say, okay, this is the problem. This is the problem of increasing portion of food. You understand? If, for example, maybe on Monday I ate in group, so I increase my portion. On Tuesday I ate alone, but I still increase my portion. On Thursday, I ordered for food, but my portion increased. If you can see, we have 3 different reasons for increasing portion. So that might not be the problem. You should think deep. You understand? Review deeply. You are going to get a unique reason, one particular reason why you are increasing your portion. Maybe you don't sleep well. You don't get enough quality night sleep. So that is why you are increasing your portions, because you crave more for food. Or another reason may be that you don't hydrate yourself well. You understand? So if you don't hydrate yourself well, then try educating the client. You see, your reason is not because you eat in group, because Monday you ate in group, you increase your portion. Tuesday you ate alone, but still your portion is much. Wednesday you ordered food, but you ordered portion that is above what you need to eat. So it is not eating in group that is your problem. You understand? I think, let's see, how many hours night sleep have you been having for the past 3 days? Maybe from then you'll notice that she do sleep very late, or he do sleep very late, or he's not hydrating herself well. So in essence, you have to think critically, think deeply before you come up to a problem, to the cause of a problem, so that you get the solution. You understand? If not, you are not going to see results. Another thing is, if there is what increase in body weight. Yes, if you have, for example, this week, there is increase in 0.5 kg. Another week, the weight is okay. You understand? You did not add any kg, even 0.1. Maybe the first week your weight was 90 kg. Then the second week, 90.5. You understand? The third week, 90.5. The fourth week, 90.5. So you may not take this as a serious problem. You understand? But if, for example, the first week, 90 kg, second week, 92 kg, third week, 93 kg, then there is cause for alarm. You have to what? Sit and review everything. Then another thing is, you have to be constantly reviewing situations that can pose risks of regaining the weight. At every visit, keep reminding your clients. You have to be aware. You know your weak point from your findings. Eating in group is your weak point. Visiting your friend, that your particular friend, is your weak point. Eating at the restaurant is your weak point. Watching those movies at night or around the time of your exercise are your weak points. If you know the weak points or the problems of your particular client, you keep reminding the client. You understand? Each visit, you keep reminding the client so that the client will be intentional all the time. Another way of maintaining this weight is what? Discontinuing real-time monitoring of food intake. You understand? The timing, writing of time. You know, at the initial stage, I emphasize on time. You have to write the time of taking that particular food. If you've done the program from inception to the end of phase 1, that is 6 months. If you do it, if 80% you are on track, it's only 20% you are on track for this 6 months. I'm telling you that all the skills and good habits that you've learned will become part of you. You understand? So even without writing the timing, you are going to maintain the time of eating your food. So to make you to be less dependent on the recording of the time, you stop writing the time. You understand? You just try and document what you've eaten, so that if any problem arises, we can go back and check whether the problem is from the food. But at the later stage, real timing of food don't usually give problem. So the next is evaluating possible future weight loss attempts. If, as I said, we are going to stop the weight loss, the active weight loss phase at the end of phase 1, which is at the end of 24 weeks. And you are going to maintain the weight for 1 year. You understand? 1 year. That is phase 2 of the program. We're going to talk about that. If after 1 year you've maintained your weight, there is no any significant increase in the weight, then you can what? Further initiate another weight loss phase. You understand? Because it's assumed that you have what? You have learned those habits. You understand? The habits are a part of you. Nobody will be scared that you may regain the weight. For you to even continue the weight loss, you can even do it alone without supervision of anybody. You understand? If you really took your time to do the right thing at the first first phase and second phase of first will I say program of the weight loss, and still the patient the client did not reach his or her target weight, if the client was able to maintain the weight for 1 year, that client can initiate another weight loss program without even your supervision. You understand? But if he chose to, he chose that you should supervise him or coach him again, there is no problem. You can do that. But if he or she can maintain the weight for 1 year, that person is a master of his or her journey. So another thing is evaluating possible future weight loss attempt, reason and risks. Okay, we've said that if the patient was able to maintain the weight, he or she can continue the weight loss if there is reason to do that. Maybe he or she did not reach their target weight, or the client is still within the obese category, or the client is still within the overweight category. So you see there is need for that client to continue the program. Then the next thing for weight loss maintenance is you have to prepare for the weight maintenance plan. Thus, you have to note the weight you've maintained, you understand? So if there is any addition that is not significant or any reduction that is not significant, please, there is no cause for alarm. I said increment of 0.5 kg or reduction in 0.5 kg for a long period of time, that will not be a problem. You understand? Another thing is you have to still record your client, keep reminding your client for the reason for him or her to maintain that weight loss. And also keep revising the process, the procedure to achieve the weight loss maintenance. You understand? Also the procedure to prevent weight regain. You've already explained everything to the client, but if the client comes for another visit, please still revise all what you've taught the client so that the client will not miss anything, you understand, or will not miss any point. So now at the end of phase 1, which sometimes overlap with phase 2, this is where bringing the treatment, this is where you bring the treatment to a close. You understand? You lecture or educate the patient on what? Self-efficacy and confidence. You understand? Remind the client that you have already equipped him with the tools and skills to maintain his or her weight. So you can even revise it. You can even seek to hear from the client, what are the ways you feel you can maintain your weight? What are the ways you feel you can initiate another weight loss program in order to reach your target? You understand? You can keep revising this with the client from time to time so that it will become part of the client. Another thing is you should congratulate the patient for what? Achieving the result you were able to achieve. You understand? Congratulate the patient because it's not easy. You can even reward the client. You understand? And keep encouraging the patient to continue applying all the skills he has learned, all the behavioral skills he has learned, all the cognitive skills he has learned. You understand? So that he will get a lasting solution to his weight. After that, you will invite the patient to attend post-treatment review session every 3 months for a period of at least 1 year. You understand? At the end of phase 2. So at the end of phase 1, I've explained all the modules from module 1 to module 6, but I want you to know that there is overlap between phase 1 and phase 2, starting from module 4 of the program. You understand? What is module 4 of the program. It is what? Addressing obstacle to what? Weight loss. So that is what the beginning of phase 2. So there is overlap of phases at module 4, 5, and 6. So as I've said earlier on, phase 2 of this cognitive behavioral therapy built upon the foundation established in phase 1, focusing on maintaining weight loss and addressing obstacles to weight maintenance. You understand? From the introduction, I told you that phase 1 is the actual weight loss. Is the what? Actual weight loss, where you aim to lose 0.5 to 1 kg. While phase 2 is the maintenance phase. But phase 1 starts from module 1 to module 6, because all what you've achieved in your phase 1, it's something you carry throughout the phases. It is something that you keep at module 4, addressing obstacle to weight loss. Because you want to address obstacle to weight loss, that does not mean you will stop your healthy eating that you've learned in the previous modules. That does not mean you will stop your physical activity that you've learned in the previous modules. You are going to carry it along your what? Your module 4. You understand? And from where you start addressing obstacle to weight loss, that is where the maintenance phase starts, the preparatory part of the phase 2. You understand? Phase 2, as I said earlier on, is where the what? Maintenance phase starts, and it usually lasts for 1 year. And the 1 year, the visit is monthly. So it is 12 visits per what? Per year. You understand? 12 visits monthly. So the maintenance phase, the phase 2 is purely the maintenance phase. This is where you discuss on all the procedures I've explained in module 5 and 6 and 4 on how to maintain the weight, the procedures to maintain the weight. This is where you keep emphasizing about it, because I told you at the end of phase 2, you stop every effort to lose weight. What you just aim at is what? To maintain the weight. You understand? And that is where phase 2 starts. So there is overlap of sessions between phase 1 and phase 2. And that is at module 4, where you start addressing the cognitive part of the program. So, as I said earlier on, while the exact module distribution between phases isn't strictly defined, phase 2 typically cover module 4 to 6. You understand? Phase 2 covers module 4 to 6. And still, there is a part of phase 2 in module 4 to 6, because you still keep practicing what you've learned in module 1, 2, 3, which is the phase of active weight loss. You understand? So in module 4, we're addressing obstacle to weight loss. And we've already explained all the procedures you are going to use in order to address this obstacle. You are going to develop a personal formulation to identify processes hindering weight loss. So it is personalized. Every client has his own unique obstacles. So that is what you are going to address. Don't address obstacle that is not unique to your client. It will not make sense to that particular client, and you will even waste time. You understand? So try and identify obstacle unique to the particular client you are treating, and you try to address it. Then you design personalized procedures to address specific obstacle. That is what I've just finished explaining. And another important part of this is involving significant others in treatment to facilitate lifestyle change. Support system. Support system is very, very important. You can have an online group that you add all your clients that have achieved their weight loss, you understand, their target weights, so that you keep motivating them, keep reminding them, keep asking them from time to time. Because after the whole program, after the phase 1 visit and the phase 2 visit that is monthly, you follow up for a year at 3-month interval, that is quarterly. after every three months, you understand, you are going to be following up your client. So if you can't reach your client, you may not know what the client is facing. So it's important to have an online support group, or yes, an online support group where all your clients that have successfully achieved their target will be there, so that you keep motivating them, keep educating them, and keep reminding them. So the phase 2, module 5, is addressing weight loss dissatisfaction. So here, we've already explained the procedures. You have to dictate and address weight loss dissatisfaction using the what? Questionnaire, the weight loss dissatisfaction questionnaire. I'm going to share it with you. It's from the findings of the questionnaire that you're going to address your client based on his unique problem. So, then we'll move to model 6. Model 6 is addressing obstacle to weight maintenance. We've already explained that. This is where every effort to lose weight is stopped. You understand? You maintain the portion of the food and the combination of food you are eating. You maintain the steps you are achieving daily, and the form of exercise and the dosage of exercise you are doing at that particular point in time. So you only try to maintain the weight. And we've stated a lot of procedures, about, I think, 15 or 13 ways for you to maintain your weight. So another important part of this is you have to review changes achieved through the weight loss. You have to create a weight maintenance plan. We've stated it, we've explained it earlier on. Then you have to identify and address high-risk situation for weight regain. We have already explained this also. So these models are designed to be flexible and adaptable to individual patient needs, ensuring a personalized approach to weight management. So that is why it is what? Personalized. That is why it is called personalized approach to weight loss, because you address client concern as an entity. You don't generalize. You understand? So in conclusion, it's important to know that CBTOB is an effective approach for achieving sustainable weight loss, improving mental health, and developing long-term healthy habits. It empowers individuals to take control of their weight and well-being. Thank you for listening.
Thank you.
Hello.
Thank you, Ma.
Oh, you're welcome. We've come to the end of cognitive behavioral therapy. It may sound bulky, but it's not. If you should go through everything and all the documents given, you'll be able to apply it on your clients. And I'm very sure you and your client will be happy and you'll be satisfied. So if there are questions, please let me attend to.
Good afternoon, Ma, and thank you for this wonderful presentation. I only have a little concern or question that I want to raise. Ma, concerning the people in remote areas and like they want to engage in weight reduction, and fortunately you only have to meet them once, and they say that maybe if you can do it like on the phone to give them some advices, or how can they go to see that they have reduced weight. You can see some people go on starving themselves, which in the subsequent in the course of your presentation you have highlighted that it's not that they are starving themselves, but just the modification of caloric intake. So, and it will be very difficult for those in the village or remote areas to like quantify the amount of calories that they will usually take. Like those in the cities or in developed countries that they have all those canned food and their calories are easily indicated, so that to quantify the amount of food or diet they should take together with some physical activity and exercise to be able to modify their weight. So how can you go with those kind of people that they will be eating? Like if you ask them to abstain from such food, like it's like you are starving them because maybe you can't afford that. This is what they can easily take.
Okay, this is a very good question. Thank you for this question. Do you know something? Sometimes those in remote areas tend to even eat more healthier than also.
Yes, ma'am.
Sometimes those in remote areas tend to eat more healthier food than us.
Yes.
For
Okay.
example, For example, let's talk of the village where I come from. You understand? If they want to make swallow, they don't remove the shaft. So it is the whole grains they process in making the swallow. So the swallow they make, it's intact with all its nutritive content. You understand? So it's very, very easy for you to show them how to do it. You are going to provide them with the measuring cups. I don't know whether you attended the last last week session that we had. We talk
No, ma, I
about,
haven't.
okay, maybe that's why. We discuss about estimating, that's creating calorie shortage or calorie deficit using two approach. The
Yeah.
calorie estimation we talk about and the what portioning of food. You understand? So, what did you say?
Yes, ma, I'm staying at Gombe.
You can do it at Gombe. What you do, you use the portioning method to create calorie deficit for them. If you want to, if you want them to quantify the food they eat, you can tell a client to come to your center or to your clinic with the plate he used in eating or the bowl he or she used in eating. You understand?
Yes, ma.
That client will definitely tell you, okay, my lunch, I can take half of this plate, or I fill this plate to the brim if I want to eat it, if I want to eat food.
Yes, ma.
Since that particular client is adding weight, without you measuring, without anybody telling you, you definitely know that the portion the client is taking is above his body requirement. So what you would do to ease the procedure for you and the client is for you to tell the client to reduce the portion. Maybe you start by advising the patient to divide the food into three. Divide your portion into three and be taking two portions for now. After like 2 or 3 weeks, you now tell the client, okay, you are going to divide your food into two and be taking half of it. You understand?
Yes, ma. Okay, okay,
Then
okay. There is a one client I think that she like deliberately caught taking too much food. Like she said that she want to reduce her weight, and unfortunately she came down with hypoproteinemia. She was diagnosed with that,
so
and then the doctor asked me like, let her continue eating
okay.
her food.
No. Okay, I'm explaining. I did not finish explaining before you add
Okay,
to what before you
okay,
talk.
okay, ma,
What
sorry. Okay.
I'm explaining first is portioning. The first thing
Yeah.
you will do is to reduce the portion. Then what is the composition of the food? You understand?
Yes, yes, ma.
The reduced portion, what is the composition of the food? The food must be balanced diet. It must contain all the classes of food in the right proportion.
Okay.
You educate them on how to on their carbohydrate, their energy giving food. You explain to them in a way they will understand. You will not be telling them carbohydrate. You will not be telling them energy giving food. It depends if that person is Hausa or Fulani or any language. You can use even your language to explain. If it is Hausa, wannan carbohydrate din is abincin da yake baku kuzari ne.
Yes,
Kuma
ma.
in your locality, you identify carbohydrate in their locality for them. Tell them if they have rice is a carbohydrate. Swallow you take is carbohydrate. Kunu you take is carbohydrate. So every meal you take, you must include your carbohydrate. Then secondly, you talk to them about protein. You understand? The
Yes, ma.
importance of protein in a lay language that they will understand. Did you get me?
Yes, yes, ma.
Then you now identify options, proteins options in that particular locality. They have you said Gombe, they are Fulanis, she?
Yes, ma.
So you talk of milk, you talk of beans, you talk of tofu awara, you talk of egg,
Yes,
you
yes,
talk of meat. You understand? Then
yes,
you
ma.
talk to them about the importance of including vegetables. You identify the available vegetable in their locality. Then you tell them the quantity they're supposed to be taking with each meal. Are you getting me?
Yes, ma'am, I'm getting you.
You also identify the fruits in that locality. You advise them on the portion to be taken. So if you should
Yes.
go back to what we discussed last week, you are going to understand how to do it. It's not only reducing the portion, but what enriching the portion.
Okay, yes, thank you.
The portion must be what? Balance.
Okay, thank you, ma'am.
Yeah, you're welcome.
And thank you for answering my question.
You're welcome. Please, I need more questions or contributions.
Hello?
Yes, I can hear you. I can hear you.
I have 3 questions, please.
Okay.
The first one is beans a protein or a carbohydrate? And
You are not audible. I can't hear you.
my question is that is beans a protein or a carbohydrate? My first question.
Mm-hmm.
The second question is, what can you say about using supplements for losing weight
Mm-hmm.
or the plain meal replacement?
Okay, the first one is beans a carbohydrate or a protein? Secondly is what do you talk about? What is your second question?
I said, what can
Supplement
you
for
say about using supplements for losing weight?
mm-hmm. Then what is the third question?
My third question is, how many steps should I take every day?
How many what?
How many steps, like the walking, how many steps to one take?
Okay. So your first question that you said is beans a protein or carbohydrate? Beans is combination of two. You understand?
Yes, ma'am.
Every food that you can see, only very few food is will I say it's only okay. For example, let me give you an example. Like chicken. Chicken is purely protein. It's made up of a larger percentage of protein and fat. Almost all your classes of food that you are seeing, like your rice contains certain percentage of protein, but the percentage is negligible, not significant. The percentage of carbohydrate content of rice outweigh the percentage of the protein content of rice. That is why rice is termed as a carbohydrate. Did you get me?
Yes, ma'am.
So beans contains a percentage of carbohydrate, but the portion of protein to carbohydrate content of beans, the protein content outweighs the carbohydrate content. That is why you mostly classify beans as protein, but it contains carbohydrates. Did you get me?
Yes, ma'am.
Then secondly, you said, what did I say about the use of supplement for weight loss?
Yes. Like that or
It's not
plain,
sustainable.
yes. Okay.
Supplement is not, you achieve the weight loss, but it's not going to be sustained. And if you sustain it, if you take it for a long period of time, you are going to come up with nutritional deficiency. Because what most supplement for weight loss, what it does is it suppresses your appetite. It reduces your appetite. So if it reduces your appetite, you will not eat. You will not eat at all. You understand? So it will lead to over restriction of diet. And if there is over restriction of diet, you are going to come up with what? Nutritional deficiency. You are going to lose the weight, but you are not going to sustain it. If it is sustained, you are going to come up with nutritional deficiency. And what we are concerned as professionals is you should lose weight in a healthy way.
No.
Then the last question is, how many steps do you supposed to take per day? Well, it depends on your activity level and your goal. You understand? If you want to maintain your weight, if you want to maintain your weight, 5,000, if for example you are not active, if you are not active at all, and you are not you don't want to lose weight, you just want to maintain your weight, 5,000 steps daily is okay, is enough. You understand? But if you want to lose weight, you have to take up to 10,000 steps.
Okay.
Did you get me?
Yes, ma'am.
And
Yes, ma'am.
remember, I said you will not just start with the 5,000 step if you are sedentary. You have to build on your activity level. If your starting step is 2,000 steps, then you gradually increase the step until you reach 5,000 steps if you just want to maintain your weight. Then if you want to lose your weight, you gradually increase your step till you reach the 10,000 steps.
Okay.
Mm.
Okay.
Are you clear?
Yes, very clearly.
Okay.
Thank you.
You're welcome.
Please, I have another question. I'm sorry, although it's out of our own modules. Hello?
Go on.
My question is that, what of those that usually take supplement for weight gain, like to add up
Hmm.
weight?
Can you give me example of the supplements?
I don't really. Some they say that they take one pills like supplement just that it will have them. So some usually call it Hausa like Shaka Pashi, but I don't know
Excellent.
this.
Do you know what is shakafashi?
No, I don't really know. But I heard people talking about it.
To shakafashi is a drug. You understand? Mostly, what is the common name of this drug? I can't recall the common name of the drug. It's a drug, and the aim of the drug is not to add weight. What it does, it's usually those asthmatic patients do use it. I can't recall the name. I've forgotten the common name. But what it does, it it retain water in their body.
Okay.
You understand? It
Yes,
retain
ma'am.
water in their body. So even if you should see someone that had weight using shakapashi, you find out that the weight is usually on the face, the feet, and the arm. The areas they want to add up the weight there is usually not significant. So it's not
Okay.
healthy because the drug is not for weight gain. The drug is what usually used for allergic reactions. I can't recall the name of the drug. So what it
Okay.
does, it add up, it retains water in their body.
Ma,
So they
Okay.
is
will
it
put the
antihistamine, ma?
sir.
Ma, are they antihistamines?
Yes, they are antihistamine. It has a common name.
So,
It escaped my memory. I don't know if anyone
is
can
it,
recall the name.
uh,
Prednisolone.
I don't know.
Excellent.
Let me see.
They take,
Prednisolone. Okay.
yes, it's prednisolone. That is what they normally take. That is what they call shakapashi.
Okay.
It
Okay.
increased their appetite and it retained water. So they thought they just have the feeling that they are adding weight, not knowing that they are doing more harm than good to their body. You
Yes.
understand? So,
Yes, ma'am.
so I think the only supplement that I can advise someone to take if he or she want to lose and to add weight is to take multivitamin, because multivitamins will increase your what? It will increase your appetite.
Yes.
So if it increases your appetite, it will increase your food intake. And if you increase your healthy portions, you add weight in a healthy way. Did you get
Okay.
me?
Yes, yes, ma'am. I get you.
Okay.
Thank you.
You're welcome.
Good afternoon, ma'am. Please, how can a patient with high uric acid level balance his diet?
Excellent. What you do is, the concern with uric acid is when someone takes a lot of protein and fatty food. Is that not so? Hello?
Hello,
Can you
yes,
hear
ma.
me? When you take proteins and high fatty food, and we said that it's very, very important for you to balance your meals if you want to lose weight. So there are foods that you don't eat when you have high uric acid. You understand? Food like the yolk of an egg. You can take your egg white, but you should not be taking your what? Egg yolk. You understand? Secondly, you should not eat beef. You understand? Beef, meat from cow. You should not eat that. You are not allowed to take depending on the level. If it is very, very high, to some extent, they will restrict you from taking even beans and tofu awara. But there are other healthy proteins that you can take. You understand? You can take proteins from chicken.
Yes, ma'am.
You can take chicken. And while you are using that chicken, you should what? Remove the skin before you prepare it. Because if you prepare it with the skin, the fatty content will be part of what you will eat. You can use fish. You understand? Are you getting me?
Yes,
You
ma'am.
can use skim milk. You understand? Skim milk like Dano Slim or Marvel. So you can get your protein source from this sources I've mentioned.
Okay. Thank you.
You're welcome.
Hello, ma.
Please, any question?
Yes, ma'am.
Okay, go on.
Okay. I know maybe you know about the meal replacement by Oriflame. I don't know if you know anything about it. They are saying that it contains all the essential nutrients we need in the body without causing like malnutrition, as you say. So please, do you know about this?
Ma, I didn't get it. What are you asking about?
About the meal replacement. It's a product of
Okay, meal
Oriflame.
replacement.
Yes,
Okay, meal replacement. Is it the one from Oriflame?
yes, ma'am. Yes. They said it contains
Well,
all the nutrients we need.
well, the meal replacement from Oriflame, from the content they've written there, it is stated that they stated almost all the nutrients you require. You understand?
Okay, ma'am. Yes.
So I don't know whether it's real because I'm not the one that is the manufacturer. You understand? But I think how we'll get to believe them is when people that use it do not come up with any nutritional deficiency. That is when we agree that yes, their meal replacement contains all the essential nutrients your body need. Do you get me?
Yes, ma'am. Yes.
So I don't know because I've not used it and I've not seen anybody that use it without any problem or with issue. So maybe since
Okay.
it's now that they are marketing it,
Yes.
maybe after some years of usage, we'll get to know whether it's real what they are saying, that it
Or not.
contains all. Yes, yes, yes.
Okay, so thank you very much. Thank you.
You're welcome. Do we have any question? Please, more questions.
Tackling depression. The one gonna be depression.
Sir, as if there are no questions.
Hello, good evening, ma.
Evening.
My question regarding to the questionnaire given. Is there any criteria
Yes.
for scoring the questionnaire attached to the questionnaire?
Okay, yes, like the importance of the questionnaire is not to score it, is to identify obstacles. You understand? Most
Okay.
of the questionnaires to identify the client concerned is not for you to score anything. Did you get me?
I'm getting you, ma.
For example, like the body image inventory questionnaire that is used to address body dissatisfaction. It's from the answer to the question it's from what your client answered that you will know whether the client is satisfied with his body or not. You understand? Like the weight loss obstacle questionnaire is from the answer that the client provide that you get to identify his particular or peculiar obstacles to his journey. So each every client is unique.
Okay.
What may serve as obstacle to client A will be different from what will serve as obstacle to client B, and you are going to know it from the answer he provided to the questions in the weight loss obstacle questionnaire.
Okay.
Are you clear?
Yes, I'm clear, ma. My second question is that regarding
Oh.
stages of changes you mentioned with regard to the
Mm-hmm.
obstacle. You made mention of pre-contemplatory, application, preparation, action, and maintenance. So if the client at the first stage, pre-contemplation, can the procedure proceed? This is my
Yes,
question.
it can.
Okay.
Yes,
so
it can.
Stop.
Understand?
Okay.
The time.
Hello, ma. Hello. Hello.
Frame that is written there 6 months. You understand? Hardly.
Yes.
With the you keep
Hello. Hello. Hello.
okay. As I was saying,
Hello, ma. I'm not hearing you, ma.
educating the patient.
Yes.
Can you hear me? Educating your patient.
Okay, I'm hearing you, ma.
Other.
Hello,
You understand?
hello. I'm not hearing you, ma.
Can you hear me now?
Yes, I'm hearing you now.
Okay, as I said, what I from the slide, 6 months, you'll be the next phase, 6 months, educating the client. Remember, this program, it's centered on patient education, patient involvement in the management. So a patient, if you are educating the patient will not stay long in a particular phase.
Yes.
Did you get me?
I'm getting you, ma.
Maybe in the first phase, he will just spend like, let's say 2 or 3 weeks. Because sometimes why people don't comply is because they don't know why you are asking them to do it, or they don't even know the benefit of doing it.
Okay. I'm hearing you, ma.
So it's not necessary. The client will not stay long in a particular phase. So the phases of changes may not really interfere with your management. So you should just continue with your program. The only thing is that do not force your client. Try as much as you can to make the client aware of the benefit of what you are asking him or her to do. You understand? And the risks of not doing what you are asking him or her to do.
Thank you, ma. But I understand that since the stages of changes are 5, and the first is scored as 0, then the second is scored as 1, the third is scored as 2, up to 4. The first one is 0. So if the client scores 0, he needs more motivation to be motivated at this stage. Yes, ma'am.
Excellent.
Thank you.
So your findings will guide you on how to educate your client.
Okay, ma. Okay, ma. Thank you, ma, for the explanation.
You're welcome. Is any other question or contribution? Please, can we call it a day if you don't have any question?
Yes, ma'am.
Okay.
Thank you.
Yeah, you're welcome.
Thank you so much for the
you,
in-depth
ma'am.
lecture.
Bye.
I'm wishing to see you some other time, and thanks everyone for participating.
Thank you,
Welcome,
sir.
sir.
Now, then put down for this week.